Everyone. Good afternoon that can join today's session. We will talk about communication skill, and I'm going to start a bit on the briefing, which I think is going to take about half an hour or 45 minutes, then followed by five candidates for practice session. So let's just go straight. So this is the outline that's going to come out in the new Diet 3. You can see that station 1 and station 4 both constitute each communication station, and it's 10 minutes in total. So it's station 1 is like 5 minutes preparation outside and then go in, com skill. After that, proceed with the respective examination, while station 4 is 5 minutes of preparation, after 10 minutes of com skill, followed by 10 minutes of endowment station. Okay, so you can see that generally we need to save about 2 minutes of the last 2 minutes for addressing the concern, and, and generally the conversation and the communication should take around 8 minutes. Okay, so this is an important slide that I feel everyone needs to know, especially in order for us to pass the exam. You can see that based on the mark sheet, the com skill actually constitute only about 16 marks out of the total 168. But in order to pass the PACES, usually we will get the overall pass without any issue. But it's these two component, communication and concern, skill C and skill E respectively, you can see that this is the one that usually will actually make us fail because in terms of component scoring, you can see that if let's say your clinical consultation skill, you didn't manage to score well, and maybe you didn't address the communication, or some examiner may not like your communication, the way of communication, they may not able to give you full marks. And if let's say one of the 2 marks is being deducted by each examiner, then you can see that it's actually quite risky. We need to score really full marks in order to get a pass. So you're talking about 11 out of 16, in which you can only minus 5 marks. Okay. And addressing the concern, usually if your diagnosis is correct and your differential diagnosis is also part of the diagnosis, and the management not much of issue, the concern is being addressed correctly. In terms of the consultation skill, usually you will get it correctly without any issue. And this is the only issue is when under the communication techniques, some may not able to get the full mark in terms of the concern. So it's also important for com skill in this 2 station, we need to score a good amount of marks in order for us to pass the 10 out of 16. Okay. So this is some tips that I'm going to brief before we begin. Generally, we should give a brief introduction, invite, and then explore the surrogate understanding first. And then we need to focusing on addressing the patient or surrogate emotion instead of giving a very detailed and in-depth explanation. So sometimes we may not able to address and explain all the condition, everything one shot is okay. So we just need to maintain our composure. At the same time, also make sure that we are feeling calm. And let's say it's a bit too much of details that we cannot finish, you can just tell the patient that I think there's a lot of cover for today. I don't want to overwhelm you. Maybe we can also arrange the next consultation after this. Would that be okay with you? So sometimes we may not need to tell everything in detail, but generally all the important things we should include them. Okay, and definitely under part of the communication skill component, they are looking whether we are using any form of jargon. Okay, so if let's say we accidentally use 1 or 2 jargon and the examiner realize it, they definitely will minus some marks under the communication component. So we definitely don't want that to happen, and we need to maintain a good eye contact as well. And sometimes a scenario that need breaking bad news, we really need to give a warning shot with a pause before we give breaking of bad news. And the principle is actually try to listen more before we talk. At the same time, we should offer less information, unless it's a scenario of just explaining a procedure or complication. Then we need to really talk about the procedure, medication, or even the diagnosis. Okay, and usually we also need to offer some management plan and advices as well as negotiation. For angry patient, don't feel angry. And the most important point is don't feel panic as well. Just keep calm and being professional. Sometimes they may feel very angry and you don't know how to deal with it. Just give some time and just say, I'm sorry for what you experienced. Okay, I'm sorry for what you have been going through. I will I will be here to help you. If you're okay, please let me explain and how can we do better from this. Okay, so also need to explore a little bit on the social history if the time is allowed. Usually, time is very limited, and definitely for new format, the time is even worse. We only got 8 minutes to cover all aspect of the com skill. So it's important for us to really address, at least to me, I feel it's important for support, asking about patient financial as well as social support. Okay, and how does the condition affect the patient currently? And if let's say a situation, a scenario that you feel the patient may not be safe for driving, then probably you should try to explore about that. And yes, concern usually we can always ask patient question as the communication skill being conveyed. But generally, sometimes you also need to save a bit of time and then ask a concern, in particularly before you end your communication skill station, because some candidate or surrogate, they may really keep some of the question at the back until you ask concern in particular, then only they will mention. And it's also important for us to prepare this com skill in detail, in the sense that we need to cover some of the common condition that we expected to know and part of the RCP syllabus, as well as we need to also cover some important procedures and explanation. So all this can be found in the NHS website, uh, NHS website, and also you can also find from the patient leaflet. Okay, so there's a few source that I mentioned here. All those leaflet and also the website is important because I feel it's quite useful. We can generally use all the words that's being used, because all those are not considered as jargon. Whatever written in the NHS patient leaflet and also the website is actually not considered as jargon. Okay, so it's safe to really use that. And another thing is that in terms of breaking bad news, especially in uh, advanced care or even those palliative condition, it's important for us to really look through and how to talk to the patient or surrogate. So this is the website I feel is quite useful, in the palliative care network being Costin. You can have a look if anyone free. So this is a general overview, just an example extracted from NHS website. So let's say the NHS website talk about Guillain-Barré syndrome. Okay, so Guillain-Barré syndrome, you can mention that this is if the scenario asking you to explain about Guillain-Barré syndrome, so how do you explain a disease? We'll talk about it later. But generally, this is what the NHS website written. You can see that it's very simple and very concise. You may not need to tell everything that is in the NHS website, but just need to go through in brief. Let's say this is a condition in which our immune system get misdirected and causes that usually attacks our bugs in our body, get misdirected and attack our own body defense mechanism, and particularly in this case attacking the nerve. And you can see that it affects the feet, the hand, the limbs, and the symptoms include numbness, weakness, as well as the problem in terms of balancing or coordination. And it can also cause difficulty to breathing or swallowing or even speak. And some patients without treatment may actually progress and get worse, cannot move their limbs or face. And what are the options? Management will be giving a specialized component of the blood, okay, be it what we call as IVIG or plasmation. You may not need to mention in detail, but you may mention that it's to give proteins that will actually bind and also reduce the amount of all these abnormal antibody in the body or in the system. Okay, and some of the time, patient may ask in the concern, what are the chance of my recovery? So sometimes you can see that in NHS website, they give a very good recovery period information. If you don't read about NHS, we may not able to answer their concern well. So you can see that most patients actually recovered well within 6 to 12 months, and around 1 in 5, about 20% of them may have some long-term problem. For example, unable to walk fully, feel weakness, and also have some balance, weakness, or numbness. Okay, so you can also stress on all these things. So all this, you can see that if you use the NHS website to guide you on explaining a disease, it's very easy. And next is actually talking about principle. So in the new format, we no longer have any YY session with the examiner to talk about ethical or legal principle. They are expecting candidate to kind of like applying the principle throughout the consultation or the communication skill. So we don't need to really talk in detail about it, and we are not particularly mentioning about any keyword, but just be alert that some of the scenario requires some specific to mention. For example, a scenario of infectious disease like TB, then we may need to apply the principle of disease notification. For example, you're talking about advanced disease, cancer that is already stage 4. You're talking about palliative or end of life care. So you need to apply all those information into your counseling. Okay, and you also need to sometimes assess the capacity for decision and also uh, uh, in the sense of getting the consent. And incident reporting and complaint is also very common that we need to address. And you can also see that this duty of candor is very important for us to apply, especially when patient have any complication or procedure, medical error, or any complaint. We should apply that in the sense that we need to tell them honestly and be open about it with or without apparent harm to the patient. Okay, so all these things we are expected to just apply. And I have listed out and classified total of 11 scenario in that can come out in the exam. First possibility is the commonest one is being explaining about any disease. Then that include breaking or bad news. Okay, and second is actually explain about procedure, and it can also explain about medication to start some medication with the underlying diagnosis, some medical condition, and also sometimes the procedure may require. Definitely, we need to talk about consent as well. Okay, and the next thing is actually the third possibility is to explain complication from medication or any procedure. Okay, the fourth possibility is the medical error and incident reporting. The fifth one is the one that sometimes we need take a bit longer when we try to practice as well as in exam. We need to talk about advanced directive, lasting power attorney, or advanced care planning. All those things is a bit difficult. It's not easy. Need some practice. And the one that we tend to be very worried is the angry surrogate that can have angry for any reason. Okay, then we need to really know what is their issue. Sometimes they may have some hidden agenda that we need to explore. Okay, to actually calm them down. And the next possibility is the refusal for any procedure or medication, and that would actually include any form of medication or any form of procedure that patients should undergo. Okay, and subsequently, genetic testing is something that you should know as well in order for you to counsel. And the rest are a bit rare, but it's something that we need to know and practice as well. For example, brainstem death, counsel about brainstem death and organ donation, transplant counseling. And the last two is really postmortem, be it the hospital postmortem or coroner's postmortem. Last one, it will be the clinical trial recruitment. Okay. So the first possibility is like what I mentioned, explain disease. We need to talk about how we should give a simple definition of a disease. It's a like autoimmune condition, like for example, Guillain-Barré. We should talk about it's a form of autoimmune disease in which our body defense mechanism get misdirected and start to attack our own body cells. Okay, and attacking which part you should mention, and you should mention about what causes it. Sometimes the cause we may not know, we are not sure about the cause. Cause can be both family related, or can be environmental, or it can be just happen out of nowhere. We are not sure, entirely sure. And the symptom will include what, and you also need to talk about complication. And the complication is the one that we need to counsel, as well as the outlook as well. So prognosis is something we should avoid. We should avoid talking about prognosis. We should use the term outlook, because outlook is not considered as jargon, but prognosis is actually part of the jargon. And we should talk a brief overview on the management plan. What are the disease management like? Be it curable, controllable, or just supportive. And in terms of management, we also good to bring out the concept of multidisciplinary treatment approach, pharmacological, non-pharmacological. And if a lady, if anything, any scenario that related to a female patient, so and especially in the childbearing age, we should talk about pregnancy and must be planned, make sure the disease is in remission, in which there's no active disease, and we should also adjust and change the medication that is potentially harmful. And next is actually to talk about precaution and follow up. What are the things that patient need to be aware and come to hospital immediately? and therefore proceeding further is the concern and also education. So any scenario, if possible, we should offer some form of education. And at the end of our summary, should provide some brochures, website, support group, as well as hospital contact. Okay, so all those things should be mentioned. This is how we explain the disease, and these are the common scenario you can see. Generally, I just split it out based on system, and all these are the one that actually came out in the old format. I believe that RCP will not change much in the sense of the possibility. Their question tends to recirculate. So it's also important for us to go through all these common conditions that you can also find in the NHS website to go through how to explain about it. And I won't go in detail about all those things. So those are some of the things like anaphylactic shock, Steven Johnson, also important for us to know. And HIV, RED, candidiasis, all those things also important as well. Okay, so second scenario is actually explain about procedure, medication, and consent. So in terms of explaining procedure, it's generally useful for us to divide into pre-procedure, procedure, and post-procedure. So we'll tell them what are the things that they need to be aware, pre-procedure and procedure as well as post-procedure. Okay, so pre-procedure, we need to know what is, just tell them what is the indication and what are the things that can happen if the procedure is not done, and what are the preparation needed. Okay, next is actually about procedure. Who will do the procedure? You can say that the procedure will be carried out by the experienced doctor, and you can say in brief about the technique as well as duration. Next, you have to mention about the post-procedure part. What are the things that they need to be aware? What are the things that will be done? For example, some monitoring, admission, or can be discharged on the same day. And next is actually explain about complication of the procedure, possible complication that the patient or surrogate may encounter. But we have to also focusing on and highlight the fact that the benefit is actually overweight the risk, and therefore, and the risk is not necessarily happening in all the patient, can be quite rare, but something that we need to inform to the patient. And what are the precaution after the procedure? And the last part, don't ever forget about procedure or even medication, is to talk about consent, a verbal consent or a so-called informed consent, in which you can say that I will pass documents, including all the information I discussed, and please read it carefully, and we are ready, please sign it, and you have a right to actually reject or even withdraw it anytime before the procedure. You can also come back to me prior to the procedure if any further question. Do you have any concern? You can mention like that. So this is how we generally approach for explain procedure. And explain about complication from procedure or medication is generally talking about we have to talk about disease in brief and what are the reasons that bring us to go for the procedure for the patient. So we must mention a disease in brief, and then we talk about what are the purpose of the procedure, and therefore the procedure is indicated, and explain that sometimes in a different individual there is a higher risk, okay, due to underlying condition, therefore the complication can happen, and procedure is actually planned at the best interest in which the benefit actually outweigh the complication. And we should also explain regarding the complication in detail, what has happened. And we also need to stress on that there is no malpractice or error involved. And this is a kind of like predictable things that can happen even in the very experienced hand of a doctor. And you should also stress out on the management that was done. For example, let's say patient have a perforation from the OGDS. You should mention that we have keep your father or your mother or any the next so-called the patient fasted. We have also started some antibiotic to prevent infection. We have referred to the surgical doctor to see that whether operation will need to be done, things like that. So we have to mention about all the management that the basic management that can be done, and then only then you talk about what is the next step. For example, you need to go in for open surgery. For example, can observe. Okay. Subsequently, we have to talk about follow-up and also precaution, and also had to give some education as well. So let's say you still got time, you can talk a bit on the social support in the sense of financially and the family. And let's say usually we only have time for these two. The rest is probably not that important. And next is actually the lastly, before we end our conversation, had to talk about whether the surrogate have any other concern. Okay. So the fourth possible scenario is the medical error or incident reporting. So we must always admit and apologize as a team. So this is the mnemonic I tend to use. Okay, AEI. Let me just check. Sorry. So AEI, AR. so-called A-arm. Okay, I used to use this mnemonic when I prepare for my exam. Generally, you can use any mnemonic, but this is the way that I tend to remember when I write outside as I prepare the scenario. We must really admit that and also apologize as a team. No, never admit and apologize as an individual. Okay, so the principle is not to find fault at particular individual, and all of our team is responsible when things goes wrong. Okay, so we must always admit and apologize first, and we explain that this error is not intentional. Okay, it's never meant to harm, and it's not intentional. Unfortunately, this thing has happened, and for that reason, I have filed an incident reporting. I inform my consultant, and the expert team will investigate how it happened and how can we prevent from happening in future. Okay, so the I is also important. Incident report, inform and investigate. And you may need to repeat apology and give some time for the surrogate to address a bit of emotion. Okay, so next is actually the autonomy. So in the talk about uh, surrogate have a right to complain, but please rest assured that we will still continue to provide the best management at the patient best interest. Okay, and you also need to mention about what has been done and what can we do next. Okay, the reaction will be the management. What are the necessary intervention immediately in order to damage control the error. Okay, and the last thing perhaps is the reassurance, and have to reassure the patient or the surrogate that the complaint will definitely not affect the management, and it's a way to help us to improve in terms of our healthcare system. And please be assured that we will still continue to provide the best care for the patient. And we may need to repeat the apology again and again throughout the consultation. And generally, sometimes this kind of scenario may combine with angry surrogate. So we need to calm the surrogate down. And sometimes we may not need to rush in to explain everything that according to this approach. We need to give some time for them to address their emotion. Okay. So next thing is the advance directive and lasting power attorney. We know that advance directive is a legal documentation, and it must be signed and witnessed from a competent patient that have a capacity. Okay. And lasting power attorney is also a legal document which assign an attorney that can consent or refuse treatment at the patient best interest. Okay, so depends on which one come first. Okay, if the patient sign an advance directive and subsequently the patient sign another lasting power attorney and directs it to the next of kin, for example, the patient's son. So the lasting power attorney is the so-called latest patient wish and also patient management. So let's say patient advance directive refuse active resusc DNAR. But let's say the patient again the daughter or the son actually talk to the patient and they sign LPA. So and the decision for LPA is for active resusc, for example. So then by right we have to follow the lasting power attorney, regardless of depending on which one is the latest one. But bear in mind that LPA is not definitive. It can also be overwritten by our medical personnel decision. It is not at the patient best interest. Okay, that's very important. It means that ultimately, let's say patient is not fit for consent, patient sign a advance directive, and the advance directive is DNAR, but the LPA which was just signed recently after the advance directive is an active resusc. We as a medical personnel have to decide whether or not he is a good candidate for active resusc. Okay, so LPA is not always the definitive. Okay, and we should always talk to the family members in order for them to understand what are the conditions and what are the reasons. Let's say you want to our best interest is actually for supportive and comfort care. What are the reasons we are saying about that? We should explain that in detail. And it also, if in a difficult situation that they refuse this and that, it's very difficult to counsel, you should involve the hospital legal team for further assistance. So I just want to see whether I haven't admit anyone. Yeah, I think it's okay. So next thing is actually you should also mention that if you feel it's difficult, you can mention that I will involve the legal team, the hospital legal team, to actually discuss in detail. Would that be okay with you? And you have to also understand that competent patients have a very clear right to decline any procedure or treatment for the reason that may look irrational and sometimes for no reason, and therefore we should respect the opinion. Okay, even if it look irrational. So the keyword is actually competent patient. Okay, this is all written in the medical law based on the NICE. So, and generally, if you want to talk about advance directive and lasting power attorney, we should probably give a very simple sentence to open up this topic. Have he or she ever expressed uh, he or she wish if become unwell one day, and has him appoint anyone to make a decision if he's unable to do so. So you can just give these two sentences to screen whether the patient have any advanced directive or LPA. Okay, and most often this kind of scenario we may also need to introduce the concept of palliative care. So you should also have some idea of how do we talk about palliative care. You can mention that it's a group of multidisciplinary care or specialized care that does not target the disease itself, but rather to make a patient comfortable by managing the pain and also some other distressing symptom. And this will involve psychologically, social, and also spiritual, and also involvement of family members as well as patient. You can mention like that. Okay, just an introduction kind of like to palliative care. So six is actually the angry surrogate. Angry surrogate, the principle is not to rush and straight away mention things that is needed. For example, the task for the scenario is for you to counsel about something in the angry surrogate. So just give some time, probably 1 or 2 minutes for the surrogate to express the emotion. And they will definitely at some point of time try to calm down. So we just need to give 1 or 2 minutes, and then we can just tell them that I'm really sorry for what have you gone, what have you gone through, and I'm here to help you. I hope that you will feel better after this. But please be assured that we all as a team will be here to help you. I'm very sorry to know what has happened. You can mention like that. And then sometimes the scenario may be very rushed. The surrogate may be straight away angry without you introducing yourself. So after you address the emotion, you may need to introduce yourself properly. I'm the doctor from medical clinic or from the ward. May I confirm that you are the Mr. John, for example? And then you also need to express a bit what was the patient understanding. If you really drag too long, so sometimes you may need to tell them that you know that your time is very limited. You can tell the surrogate that I can see that it's very overwhelmed for you to go through all these things. Is it okay if we arrange for next visit? This is kind of like a warning to the surrogate that usually if you mention like this, the surrogate will definitely stop, and then therefore we can proceed next. Okay. And sometimes if the surrogate, despite everything that you have done, they are still not happy, they are still unsatisfied. So you should also mention that we can always direct you to the patient advisory liaison service. Or if you don't want to mention about this, you can say that I will direct you to the complaint department. I will also inform my consultant. But please rest be assured, all this will not affect management, and our best interest is still at your care. Okay. And sometimes may have some hidden agenda, like I mentioned. Sometimes may be some social related issue that we need to address. For example, refers to the social, all the social service, the welfares, occupational health. Okay. So the get away way is maybe you can escalate the issue to consultant or arrange another meeting if still unhappy. Okay. So 7 is the refusal for procedure. Okay. So usually you need to know what are the reason they refuse, a surrogate refuse something, and we need to explore the understanding, and we need to kind of like explain what are the potential complications that may occur if they refuse to do so. And sometimes we may need to give some options. Certain scenario they have not much option, but some scenario they may have some options that we can try to negotiate to find a common ground. Okay, so the principle is regardless of what was being decided at the end of the com skill, regardless of whether patient agree or not, it is okay. It's okay that if patient you negotiate already, patient still refuse. It is still okay. It doesn't mean that we will fail. It just means that we need to find a way to deal about this scenario in which we should actually seek help and should actually directs the patient to talk to our consultant, for example, for further discussion. And sometimes in this kind of scenario, we may need to really decide whether patient has any uh, uh, so-called psychologically unfit for consent, in terms of they may not able to do their, may not able to have to decide their own, and therefore this brings another issue of mental health act. Let's say patient for example ingested paracetamol and come to hospital, and then let's say that they refuse admission, and refuse admission itself is also one of these possible scenario. And when you explore further what are the hidden agenda, what are the reason, you found that the patient may have a major depressive symptom, not confirmed yet, but the symptom is suggestive, got self-harm behavior prior to that. So you know that the patient is not psychologically fit for discharge and follow what the patient wants. So therefore, it's important for you to talk about mental health act. You can mention to the patient that I'm very sorry to tell you any self-harm behavior that may be potentially harmful to the patient requires our referral to our uh, mental health doctor. And this is actually based on our mental health act. They will assess you and decide whether or not you are okay emotionally. But at the same time, we will definitely uh, provide you our best care and make sure that you are safe. Okay, so sometimes need to really negotiate and find a common ground. It's difficult because different surrogate may have a different crews that they want us to explore, especially the RCP scenario. This com skill is the one that really the question bank will come from the RCP itself. Others of, like for example, clinical consultation or short cases, all those will be center dependent. So only the com skill that will come up from the RCP official federation. So we have to really prepare for all the possible scenario. Okay. So number eight is actually genetic testing. So genetic testing, we need to stress on confidentiality. Genetic testing is something that we should not invite someone else to attend the conversation, because genetic testing, we need to talk about confidentiality. And a lot of times we not necessarily need to do any detailed form of genetic counseling. We can always mention that we refer you to the genetic counselor for further information as well as for screening if indicated. And this kind of scenario, sometimes we need to have a bit of knowledge in some common condition, so-called PACES favorite condition. For example, Mann syndrome definitely need to go for genetics testing because of the high-risk mutation and certain condition. For example, prophylaxis surgery is indicated for Mann syndrome. Okay, for Holcomb, generally genetic testing is not indicated other than if, let's say, the patient have any family history of sudden death, and if, let's say, there is any professional job requirement, let's say patient work as pilot, definitely genetic testing is something need to consider. Okay, Wilson disease, hereditary hemochromatosis is the one that also important, because if it's positive, and we can refer to our the gastroenterology colleague, and this will prevent the progression to the liver cirrhosis and complication. And those are the conditions that can start treatment early. For example, chelation therapy, copper chelation, or even iron chelation. Okay, adult polycystic kidney disease is also not generally required genetic testing. Usually, screening is by ultrasound based on the Rye-Revine criteria, and usually can always proceed further. Let's say ultrasound is abnormal, fulfill the criteria, then it's already confirmed adult polycystic kidney. Doesn't always need to go for genetic testing. But in a certain condition, for example, need to identify the potential renal donor or pre-pregnancy screening, then yes, it's indicated. Another possibility is the dystrophia myotonica. So dystrophia myotonica is important because early screening will actually prevent the serious complication, like for example, respiratory distress, okay, heart condition, okay. And there are also some conditions like Huntington in which there's no benefit to do any genetic testing, or even like motor neuron disease, there's no benefit to do genetic testing, because motor neuron disease actually about 10% of the condition, it can be heritable, but yet there's no benefit to do genetic testing because there's no medication to modify the disease trajectory, and there's no definite treatment. Eventually they will progress. So on those kind of conditions, we should really know that, and to tell the family members that, or the surrogate, that there's no role to continue to go proceed with genetic testing. Okay. Next thing is actually the brainstem death, organ donation and transplant counseling. Very challenging if you come out in exam, because generally it takes time to explain. But generally, to discuss on brainstem death in brief is a form of irreversible damage to the brain that control breathing, heart, and also other vital organ function, which are essential to survive. And brainstem death, unfortunately, I'm very sorry to tell you, it actually equates to the death of a person. Okay, so sometimes we need to repeat this sentence a few times. Brainstem death is a death of a person. And we talk about organ donation is an act of giving organ or tissue to save life and improve the life of the others. And bear in mind that this is what written in the NHS leaflet as well. One person can actually save 9 people with organ donation. And generally, if this kind of scenario came out in Malaysia or in UK or in other center, have to really know about that particular country's law, organ donation law. For example, UK, they have changed their policy into opt-out policy since 2020 during the COVID time. So in which all individuals are considered an organ donor when they die, unless they opt out or so-called they are included as the excluded group. Okay, so meaning to say every UK resident will be automatically become a donor when they pass away, unless they have opt out earlier or they fulfill this excluded group, in which excluded can include if they are too young, less than 18 years old, and or lack of mental capacity, or immigrant that stay in UK less than 1 year, or visitor that's not staying in UK voluntarily, like shoulders. So other than that, for example, in Malaysia, how about Malaysia? Malaysia organ donation law, there is a specific protocol and also law which actually very old already, almost 1990s, and there is no general no update, almost more than 20 to 30 years. But generally, what the Malaysian organ law says, I mean the donation law says, let's say patient sign up for the organ donation, patient registered as an organ donation when he or she is alive. When he pass away, to decide who is going for organ donation, whether or not the patient can still donate the organ, depends on the family members. Unfortunately, this is our law, in which the next of kin need to give the permission for organ donation, despite patient himself or herself have signed up for the organ donation. So this is our law. Okay, so we need to know that in Malaysia, this is the situation. Okay, so let's say patient have already signed up for the organ donation, and now the family member refuse for organ donation. Okay, they don't want organ donation because they worry of cremation, and they don't want so-called, they maybe their concern, their hidden agenda is because they don't want to cause too much of pain to the patient, to the diseased patient anymore. So there's a lot of things that we need to explore. So sometimes we may need to tell them that this is the wish. Sometimes we have to respect the patient wish, and I hope that every one of us actually love the patient, and we need to goes what the patient really wants. Sometimes if still refuse, difficult to donate, cannot get their consent, things like that, it's still okay. No? Not necessarily we must always get the answer that we want. So, but this generally we need to mention all these things, okay? And in UK, let's say there's no patient have not opt out before and patient doesn't belong to excluded group, definitely patient is automatically is an organ donor. And what is the role of next of kin? Is just to tell them what are their special requests and requirement that actually goes in the line of the disease belief and faith. So that's the reason we are telling next of kin. We are no longer getting the consent from the next of kin for the organ donation. But in Malaysia, yes, we are actually need to inform the next of kin to get their consent for organ donation. Okay. So next is a postmortem, can be hospital or coroner's postmortem. It inform, so the definition is a simple one. It involves a careful internal examination of a diseased body to identify valuable information, especially to know about cause of death, and carried by the expert team of doctor in a highly respected manner. Okay, you must highlight these few so-called keywords. And generally, how do we define hospital postmortem and coroner's postmortem? Hospital postmortem, yes, is to diagnose and ascertain the cause of death. And second and the third important point is therefore it's not compulsory. So this involves giving hospital most postmortem indication will be include the medical education purpose, like for example medical museum for further education and training, and the third one is for the research purpose. So sometimes the next of kin may not agree for this hospital postmortem to be done. And how about coroner's postmortem? Coroner's postmortem, we need to know that coroner postmortem, the family members cannot reject. We as a doctor also cannot reject. And only coroners can decide whether or not patient should go for postmortem. Okay. So what are the indications for coroner's postmortem? This include violent, unnatural, or suspicious death, or sudden death for unknown cause, or death will occur in prison or in police custody, or any road traffic accident death, drug poisoning, or the last few are the one quite rare in which the no doctor witnessed during the last review, or if the review is not seen within the last 14 days. Generally, is the coroner's postmortem can be avoided The answer is possible, provided the coroners can accept the cause of death. For example, the scenario mentioned that a patient in the ward is improving, admitted for pneumonia, and then suddenly asystole, and then pass away. So there's no cause of death. We don't know what is the cause of death. So the family members refuse postmortem. Because of this, sudden death of unknown cause is indicated for coroner's postmortem. But family members strongly refuse a postmortem. So how do we go about it in negotiation? Is that you should tell them that actually coroners are the one that decide whether or not they can accept our cause of death. And generally, in this condition, usually the scenario will give some hint. For example, maybe it's a primary embolism, but there's no way to confirm it. So you can say that if the coroners accept our proposed cause of death, yes, postmortem can be avoided, but generally the final decision lies in the coroners. Okay, so not necessarily means that coroner's postmortem is definitive. Okay, it also depends on whether coroners can accept or not. So okay, I have finished the 10th scenario. The 11th one we will not be discussing because we are discussing during our practice session. Okay, so next we will start with our practice session. So we will start with our first candidate, Dr. Lee. Can you unmute yourself?
Hello, yeah.
Yeah. So I will give you 5 minutes to prepare the first scenario, and then after that we will proceed. Is it okay?
Yeah, sure.
Okay. So let's start. I will start timer now. Okay, time's up. Dr. Lee, are you ready?
Yeah.
Okay, let's start. So this is the patient, Madam Lee.
Okay. Madam Lee, good afternoon. This is I'm totally here, one of the doctors in the coronary care unit. May I confirm that you are Madam Lee, 65 years old?
Yeah, I'm 65.
Okay, Madam Lee, before I start the conversation, would you like anyone else to be here with you
No.
for the discussion? All right. Okay. So, Madam Lee, do you mind tell me what have you known so far regarding your condition?
Yeah, doctor, I was supposed to come in for angiogram, and that was like yesterday. I was admitted to the ward, and today I just underwent this angiogram procedure. After the angiogram, I feel shortness of breath, and I was informed by the doctor that my heart suddenly become very huge, and I have to go through this procedure to take out the fluid within my heart sac, and for that reason, I need to be monitored in this intensive unit. However, I am not sure about my status. I really want to know more, doctor.
All right. So, Madam Lee, what actually happened to you is that you actually, like you mentioned just now, you were admitted because for the procedure where we do the angiogram. However, during the angiogram, actually, there was some complication uh, from the procedure, causing there is a a hole in the blood vessels that actually supplies to the heart. So, which causes there is a blood accumulation around your heart. Therefore, uh, I believe that my colleague had actually put it a small tube that actually drain out the fluid, the blood that actually accumulated around the your heart, and now you are relatively stable. However, it actually shows that your red cell count level actually dropped quite significant. Okay, from the normal count of 13 drop to a count of 7. So can you follow me so far?
Oh no, is this something? Is this a negligence, doctor?
All right. Uh, it is not a negligence because it is part of the risk that can actually happen during the angiogram. And prior to the procedure, I am quite certain that the in charge colleague or the doctor actually explained to you that it is part of the risk, one of the risks that can actually happen during the angiography. So, uh, and after the procedure, after that, there is a small leakage or a small hole in the blood vessels. Actually, our team proceeded with resuscitation and also an emergency procedure to stabilize you. Yeah.
Oh. So what is the next step, doctor? Will I die?
All right. So, Madam Lee, let me explain to you what is our proposed plan. So, we have consulted our surgical colleague as well. So, what they suggested is that we have to proceed with an emergency operation to repair on the blood vessels that were actually leaking, or to repair the hole on the blood vessels. So basically, it is an emergency procedure. If we do not repair the hole, the blood might be continue to leak around, and your hemoglobin or the red cell level will continue to drop and might actually continue to worsen the condition.
Oh no.
Do you get? Okay, I'm
Do-
so sorry to
Does it mean
explain
that I need
to.
to go through the open surgery?
Yes, after discussion with our surgical team, the surgery will be the best option. And it is also concluded that because it's an emergency procedure and also your red cell count level actually dropped quite significant, despite giving um, what we call as a fluid to stabilize your blood pressure, it is also indicated that blood transfusion is needed.
Oh no, 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 doctor, no, no, I don't want blood transfusion, doctor. Is there any options available? I don't want blood transfusion. I'm
All
okay
right,
for surgery.
all right. I I appreciate your concern, Madam Lee, because I understand that you are actually a Jehovah Witness. However, in your situation, blood transfusion or blood product replacement will be the best option because, as mentioned just now, your red cell count level actually dropped quite significant. Therefore, it will be best to replace with red blood cell as well. That's why I'm here to discuss with you regarding the blood transfusion. So, um,
Doctor, I
as
don't want the red cell transfusion. Is there any other options?
all right. So there is also other possible option that is actually available. However, one of the option available is what we call that we actually takes your own red blood cell, own blood product from your own body. And during the procedure, during the operation, we will collect your own blood that will actually, we will collect your own blood and then we will process it and we will transfuse back to you.
Oh, that one. Oh, okay. It seems reasonable for me. I can accept that. Is there any other options?
Okay, other possible option will be we can give you, instead of blood product, we can give you other fluids. For example, what we call as a crystal colloid or crystalloid, in which it will also help in replacing the blood loss. However, it's not as good as a blood product as mentioned. Yeah.
Okay. Okay.
Mm.
So other than that, there's no other way of me replacing my red cell?
There is also other way what we call as collecting your blood prior to the operation. However, this for your condition, it is not that suitable because it's an emergency operation. If it's a if it's an elective operation in which is you have times for us to collect your blood for a few a procedure that is done that should be done a few weeks later, then it is not an it is a another option. However, in your condition, it is a little bit difficult because what we call is that your procedure is emergency. We can also give some product that is not actually a blood product, but it can also help in stimulating. It's a medication, one form of medication that can actually stimulate your body to produce more red blood cell.
Oh, okay. I would agree
Yeah,
for that. It's a medication. It's not from
it's a
somewhere.
medication.
It's not from
Yeah, it's a
other people, right? Okay,
no,
okay. I'm
it's
okay.
not from other human beings. So it's basically a
2 minutes left.
medication, okay, that can actually help to promote or stimulate the your own body from producing a red blood cell to produce red blood cell. All
Okay.
right. So, Madam Lee, so what I have discussed to you is that uh, you actually have this complication from the angiography and you require urgent operation, emergency operation. Therefore, technically, a blood transfusion will be needed. So after explanation, you actually agree for what we call a own blood transfusion and also medication to stimulate your own cell or body for producing red blood cell. Do you have any other concerns?
Yeah, I heard that there's some particles that can produce from the factory or a lab. Can those things help me to stop the bleeding?
Yes, of course, we will be giving you the clotting factors that actually not from a human being as well. It's from the medication. It's one form of medication as well. It can it can help in stopping the bleeding.
Okay.
Yeah. However, there is a risk of using it because again, because you're admitted for angiogram means that is there might be some blockage in your blood vessels. So if I give the medication, it might actually cause more blockage. So there might be a risk as well.
Okay, doctor.
Okay. So do you have any kind of concern, Madam Lee?
No, doctor.
Okay, so I would like to summarize that, Madam Lee, you actually consented for us for the operation, for the emergency operation, and you actually consented for what we call as harvesting your own blood during the operation and processing it and transfusing it back to yourself. And also you consented for us to
Okay,
give.
time's up. Time's
All right,
up.
thanks.
Okay, all right, thank you. So yeah, very difficult scenario, right?
Exactly.
Yeah, because you can see that now the comp skill has been cut short to 8 minutes plus 2 minutes of concern is really
Mm,
quite tight. Huh? I
yeah.
think I think generally you do well, but I feel like certain things that you may need to omit in the sense that the initial part, because all those things that has already been written, meaning to say it's already been discussed and conveyed to the patient. So I think your idea is not to discuss in detail about the angiogram and the bleeding. Yes, I give a bit of hint to kind of like negligence, this to address the complication from the procedure. And
Mm,
but generally you should focus more on the surgery, and for surgery need transfusion. I think you need to go into the topic of blood transfusion early for this scenario, because actually you spend about 2 minutes and 30
minutes.
before talk about blood transfusion, because you see the scenario, explain to
Mm,
her regarding current condition, idea of blood transfusion and the option available. So current condition, yes, probably you can only spend about 1 minute, maximum maybe 1 or 2 minutes, but you should go into the idea of blood transfusion, because in this scenario you actually did not ask the surrogate anything about what is the idea of blood transfusion. You should away,
mm,
because the outside scenario mentioned that she is a Giovanna witness, so you should have mentioned that you are a Giovanna witness. So you should really explore the idea lah, the idea of the
okay.
patient. What are you think? What is your idea on blood transfusion? This is a very emergency situation. I'm very sorry to tell you, but I really need to know what is your idea. Are you able to accept any form of blood products? Okay, and
Okay.
other than that, I think it's okay. And the options available, you should list out one by one if possible. And for each option, you can mention it out before the surrogate hint you lah. And the
Mm,
concern for this scenario, nothing much, because time is quite tight. Most of the concern I've asked already lah. Basically, is this a medical error? Is this can I avoid all those things, blood transfusion, and is there any options available lah? Jenny just want to go through the scenario lah. It's very long scenario, but basically I feel the scenario should split into few parts. First is to describe about, I mean, after introduce, invite, exploring the patient idea, straight away go to explain the complication for the procedure. Had to apologize that the
okay.
complication has occurred and it's not intentional, and it can occur even in a very experienced hand. Okay, and the management is to for that reason, the fluid within the heart sac has already been drained out. However, the surgeon need to go in for emergency operation to repair the vessel of the heart, because it can be life-threatening situation, and you can straight away jump into the blood transfusion. And for this, in this condition, the blood transfusion is really indicated to stabilize the condition before and during your surgery, and it's extremely important to replace the blood loss. And you need to mention a bit on the blood transfusion. Blood contains about red cell that carry oxygen, uh, to ensure that all the organs can function well. Without this, your organ will be injured and fail to function completely. Only then, what is your idea on blood transfusion as a life-saving treatment? So must stress on the reason of transfusing blood is for life-saving. And then, yes, patient will respectfully refuse, and after they convey about the idea and Giovanna Winners, things like that, and you may want to tell that appreciate idea. However, it's important for you to understand the seriousness, which can be very deadly. How do you feel about it? And then if it's difficult for you, how about giving blood transfusion out of sight from family and friends with strict confidentiality? How do you think about this? That means it's actually whether patient can accept blood transfusion without being known to anyone else with a strict confidentiality. So this question kind of like one of the screening question that we need to ask, especially in Giovanna witness. Although most of them will say no, definitely. Next is actually the options. You need to talk about pellet, clotting factor, or synthetic form. For example, all those FFP. FFP usually is still from the other people, but synthetic clotting factor like all those PCC. Yeah, we need to talk about it. And then the cell salvage. I think you mentioned about cell salvage and EPO, which is good enough. I think generally the time is very tight. You can mention that other than red cell, there's also another component called pellet, which can help the blood to clot when there's bleeding. And how will you accept this? However, this is also acquired from other individuals. Are you okay with this? If you say no, then you say that how about clotting factors with which the particles that from the blood that help to stop the clot? There's also synthetic form which you make from the lab. Are you okay? Then only you talk about cell salvage. I know you're talking about cell salvage. You avoid mentioning the medical term, but it's okay as long as they understand. And self-salvage, you need to focus on one point in which you need to mention that, yes, you mentioned about collecting blood loss, transfuse, and filter, but you need to mention that this will be a continuous circuit with no break in the cycle. You need to mention about this. If you don't mention this, some student may actually say no, because it is something external. I cannot accept anything from the external. So you must mention it as a continuous circuit and no break in the cycle. Okay. And the EPO is something that you can offer despite, yes, EPO is only for elective surgery. But if you look at the Juvenile Witness NHS guideline, they also recommended to give EPO in an acute situation because EPO effect only works few days later. At most, it's like 1 to 2 weeks in order to able to boost up the red cell. But in the acute situation, you can still give, okay? And and this is something that perhaps is the only option that you can tell the patient. You give medication to stimulate your body to produce more red cell. And generally, it does not involve any form of medication derived from any human. Is it okay with that? Okay. So if you got time, definitely for this situation, to mention all these things alone is quite heavy. Social address is a bit difficult. If you got time, you can say that I can see uh your condition. And maybe instead of asking that, you may want to ask about do you have any family members around with you? Are you staying alone? Okay. So if you got time, if you no time, then it's okay. And I think the summary part, instead of you summarizing, because it's very tight, perhaps it's more important for you to ask about any other concern first, only then you summarize. Because what you did was you summarize the case, you summarize that patient with refused blood transfusion but accept this and this. And do you have any other concern? It's a bit risky because you may miss out some other concern that the patient may have lah. So if patient have concern, you may not need to summarize because you don't have time also, but it's okay if you don't summarize also. So if you have time in this scenario, you will say that all these things will be documented. The important part is perhaps not to mention all these things, is to mention that our discussion will be documented and countersigned, and you are still able to change your decision prior to the transfusion. And please be assured that whatever things we do will goes in the line of your preference and you respect your decision. Okay, that's all. Basically, if you want to tell a bit more, you can say leaflet brochures on blood transfusion and get back to us. But I think generally this scenario is a difficult scenario. It's a long scenario. Definitely in 8 minutes plus 2 minutes, total of 10 minutes is a bit difficult. But it's still possible. Actually, if you simplify this scenario, nothing much that we need to counsel. We need to just explain a little bit on complication, address a bit of emotion, then straight away go to transfusion and explore the idea on the transfusion and try to negotiate with the patient whether can be transfused out the site, cannot, then what are the options. Then talk a bit on the social and then is addressing the concern and summarize. That will be it. Okay. Any question for this patient? Okay, Melody?
Yeah, okay.
Yeah, okay. No question?
No question.
Yeah, I think Giovanna Winters is a very old scenario. Usually, the scenario comes like upper GI bleed, massive upper GI bleed, patient don't want to transfuse, and what are the options available? So those are the classical RCP scenario lah. This scenario I modified from the real life case. Patient with Giovanna Winters really have a coronary perforation, develop cardiac tamponade, and want to go for open surgery and refuse blood transfusion. A very difficult scenario. But yet, I mean, it's almost the same principle regarding the Giovanna Winters approach. So if you classify this scenario will be a scenario on refusal of procedure, okay, which is the blood transfusion. This scenario is no longer just explain about complication from procedure. It's more to refusal of procedure or medication, including for this one is the blood transfusion. Okay, so we'll proceed with the second candidate. And I cannot remember who is the second one. Second one will be Cheong. Dr. Cheong, are you there?
Yeah, I'm here. Can you listen?
Yeah, I can
Can
hear
you
you.
hear? Yeah, okay.
Yes, I can hear. So I will give you 5 minutes. Okay. So
Okay.
after 5 minutes, we will start. Is it okay?
Okay.
Okay. So your 5 minutes start now. Oh, sorry. Yeah. Okay, 5 minutes up. Dr. Chong, are you ready?
Yeah, I'm ready. Yeah.
So this is the patient,
Okay.
Mr. Patrick.
Okay. Mr. Good afternoon, Mr. I'm Dr. Chong here. I'm the one of the on-call doctors in the cardiology ward. Am I talking to Mr. Patrick, 60 years old?
Yeah, I'm Patrick.
Okay. Mr. Patrick, how do you feel now? You have done the
Sorry?
procedure today. How
Yeah,
are you feeling now?
yeah,
Because you already underwent a pacemaker today.
yeah, I feel breathless, doctor.
Okay. Okay, I put you on oxygen, so we check your oxygen levels and to make sure you are much more better, yeah. Okay.
Mm.
Mr. Patrick's okay, I understand that you already underwent the pacemaker today and now you had a difficulty breathing. After the procedure, we have X-ray done. Unfortunately, that I've not good not there's no good I've not I don't have a good news for you. Are you okay if I continue my conversation?
What happened, doctor?
Mr. Patrick, during the procedure of the pacemaker done by my cardiologist, we have some small complications. Okay,
Oh, okay.
it's called
What
yes.
complication?
Okay, it's caused an air leak into your lung sac.
Okay.
So, okay, it's an emergency situation that we is warranted some urgent management.
Mm.
Okay, this procedure is called chest tube insertion.
Sorry. You're going to what? Insert a chest tube on me?
Yes, yes, Mr. Patrick, don't let me talk about the chest tube. Are you okay?
No, doctor. Why I need a chest tube, doctor? You mentioned there's some
Um,
air leak. What is that, doctor?
because generally in our lungs we have a air sac that outside our lungs that to for protect as a separation layers, but now the layers is filled up of air, and then it actually causing how compress your lung become smaller. That's why that cause you feel breathlessness.
Okay. Okay. So if I don't want this, what will happen, doctor?
Okay,
I feel
Mr.
better
Patrick.
already on oxygen. I don't think I need this, doctor.
Mr. Patrick, okay, due to the from the chest X-ray, we noted the air leak is quite extensive. Is if let's say there's no chest tube being inserted, the possibility that might occurs is your blood pressure might get compromised, and also the and worsening the tension. So that's why I reassure that this procedure should be done for you immediately.
Okay. Do you mean I I can pass away if I don't do anything?
This might happen, but of course this procedure is important as to prevent this happen. Do you need me to talk to your family members, or because I know that you must be shocked with this current situation.
No. It's okay, doctor. I want to make my own decision.
Mm, I'm so sorry. This is a known complications that um, it might happen in any patients that despite experienced cardiologists for the procedure.
I see. Doctor, is this negligence, doctor? I feel very sad that this thing has happened on me.
Mr. Patrick, I understand your concern. However, this is a known complications that for every patients that underwent any procedures in and explanation being given by cardiologists before proceeding with the pacemaker insertion. However, now is the complication arise. So I have to address this concern, and then we might need to deal with the complications now.
Doctor, you mentioned want to put in a tube for me. Can you tell me
Yes,
more about it?
yes, Mr. Patrick. Chest tube is a plastic is a tube that will inserted to your to your chest wall. We make generally we will make a small nick over the chest area. Okay, in what we call a safety triangle, and then we before we do that procedure, we will put you in local anesthesia. So make sure during the procedure you are not in pain, and we make a nick, and then we will find where to then address in a very sterile procedure, and then we will put in a tube inside the lung inside the air sac. Then we connect it, and then we will put in a water level, what we call underwater seal, to see whether then to drain the let the air drain out. So during the after successfully inserting the chest tube, generally there's a bubbling in the water, indicates actually the chest tube is being successfully inserted, and subsequently you will feel better after the chest tube insertion. Do you get me?
Yeah, yeah. How long I need to put on this tube, doctor?
Okay, generally the chest tube is we will monitor daily, and also monitor whether the system actually working. So usually by and then after the insertion of chest tube, we will straight away straight repeat a chest X-ray to see the location of our tube, and also at the same time, the daily monitoring generally for overall usually is like a few days of the 2 to 3 days chest tube. Then if let's say there's no more bubbling and the X-ray Mr. Patrick's shows X-ray showed there's a fully expansion of your lung, so we will decided to remove the chest tube.
Oh, this sounds scary, doctor. Is there any possible risk?
Okay, Mr. Patrick, I understand your concern. There's definitely there is some risk during the procedure where they can cause during the procedure causing you pain. That's why before the procedure we offered the local anesthesia. Or if the local anesthesia is not insufficient, we might put you give you some sleeping medications to help you. And I think another possibility that's cause it might cause bleeding, and if bleeding arises, we might need to during the same tube can drain the blood, but at the same time also we need to might need blood transfusion. Generally, it less happen if it's very rarely happen if rarely happen. Another possibility is some patients develop a very long if it's what we call is a connection that generally after a few days or so the chest tube system still bubbling,
Few
so
minutes left.
might we might need to proceed a CT scan to diagnose that whether this complication arises that might warrant a surgery.
Okay, okay, doctor.
Hmm.
And anything I need to be aware while on this tube?
Mr. Patrick, you no need to worry. If let's say after we put this chest tube, we'll monitor you under in our ward. So and then we will monitor your oxygen level, and also you just let us know if you feel discomfort, and yeah.
Can I walk,
Anything
doctor, in
that
the ward?
concerns generally, maybe for first few days, you might just complete rest in the bed. Then subsequently, after of the chest tube, we will allow you to walk. And at the same time, so you might need during the chest tube insertion, we will teach you the breathing exercise, and also some incentive spirometry to help out the lungs for better expansion.
Okay, doctor.
Anything else you want to ask me, Mr. Patrick, before I proceed with the chest tube insertion?
No, no, no. Do I need to sign
Okay.
anything, doctor?
Yeah, Mr. Patrick, I would like you to sign a consent that you understand this procedure with the risk that I told you before.
Okay, doctor. I'm agreeable. I need to I need to go through this procedure. I'm very scared of dying, doctor.
Understand your concern, Mr. Patrick. I reassure you that this procedure will be done and will be done smoothly by all of our doctors here.
Okay, doctor.
Okay. Thank you, Mr. Patrick. I will come to you in a while.
Okay.
Thank you.
You still got 10 seconds. How do you want to end
Okay.
this?
I think no need.
Yeah, but you still got 10 seconds, right? You should really talk until the time ends. Lah.
Ah,
Okay.
okay.
How do you feel generally?
Um,
A bit anxious, right?
yeah.
I can
Yeah.
see, I can feel you are very anxious. So the first thing, before you explain about what has happened, you did not ask the patient the idea.
Mm,
So
okay.
so Mr. Patrick, can you tell me what do you know about your condition so far before we begin? You should we explain about we have do the pacemaker for you and unfortunately suffer complication. That is your opening
Oh,
sentence. So it's a bit too early when you go in.
too early. Okay. Okay.
Yeah. So this is again another scenario of, I mean, this is also another not an easy scenario. There's two component. First component is to explain about complication from procedure, and second is actually explain about procedure on chest tube insertion. So there's two tasks here, and yeah, so it's not easy scenario, but again you have to have your approach. You need to allocate good amount of time to explain on the complication of the procedure, and you need to explain on the pneumothorax and followed by explain on chest tube insertion. So it's quite tight to do it in total of 10 minutes. But if you allocate your time, actually is enough. So you just need some practice. The reason why you may feel a bit anxious because you don't have a very proper flow. So you will really very scared, and then you just mention everything in detail. But actually you can pause and let the patient say more, because throughout this conversation you actually speak a lot and the patient is just yes no no yes no, and then I can ask some question about feeling fearful for the procedure, and then you start to explain a bit. But generally you should also, other than doing these three tasks, you should also try to address a bit on the patient social background emotion. You can say the patient is very scared of dying, right? So you can mention that
Yeah.
uh, I'm very sorry to hear that, but actually this is what we need to do. Do you have anyone around with you? Are you staying with anyone else? Do you want them to visit you? So you can try to offer some empathy, like, because this is really exam, and they want us to show some empathy to the patient. We cannot just explain everything in short or in detail and then without addressing the emotion much. Okay, but generally, this is the approach I will take. I will talk through lah. So basically, yes, introduce, invite an idea first. You remember all this. The important one is to introduce yourself. Invite, do you invite anyone to be around with you, and what have you understand about your condition before you talk about in detail. So this kind of scenario you need to talk about, because it's part of the explaining complication from procedure. So you need, after the patient tell you what has happened, things like that, then you can tell about uh the pacemaker was done to actually regulate your heart as you have an abnormal heart rhythm. This is all, I mean the scenario outside was mentioning about sick sinus syndrome, right? So you can say that you have some issue with the electrical conduction in your heart circuit. It can be too fast or too slow, and there's a risk that your heart may stop. So the pacemaker is actually inserted as a life-saving procedure to relieve your symptom and to return your life back to normal. Unfortunately, I would like to inform that complication had occurred despite in the experienced hand. So then the patient may ask you in detail, so what has happened? So unfortunately, there is air leakage in the space in between your right lung tissue, or in between the lung tissue over the right side of the chest. This condition is what we call as pneumothorax. It's basically, in a simpler way, means that your right side of the lung start to shrink like a balloon. Okay, you can make it like simple, or you want to draw out also can, but I think the new format, no one have any time to spare for any drawing anymore. So we basically just mention in a very simple term, leaking of air, and then causes the lung to shrink like a balloon. And then the symptom, you may experience breathlessness or dizziness because of lacking in oxygen. And this is a very life-threatening condition if the right lung unable to function, because only the remaining left side is functioning. And this may actually cause your breathing to stop. You may fall unconscious, your blood pressure may crash, and this may result in death. When you talk about complications just now, I didn't hear you mention anything about very serious kind of complication. You're mentioning about increasing breathlessness, and also you may feel dizzy because of lack of oxygen. But you don't mention about death. Death is something that we need to mention. No? You can get very massive. Like you said, tension, right? But try not to mention tension as in the communication, because tension pneumothorax or tension, some examiner may classify this as a jargon. Just mention that the air leakage may get worse and start to compress on the surrounding structure, including the heart, and that can make your heart stop and even result in death. I'm very sorry to tell you. And for that reason, we have started you on oxygen. However, in your case, oxygen is not enough to actually cause this, to actually treat this issue. We need to do a procedure called chest tube insertion. Have you heard about this before? Then you pause for a while, okay? So it involves an insertion of a tube to drain out the air in order for the lung to re-expand or expand. And this condition can be fully reversible, okay? Then you can mention about pre-procedure, procedure, and post-procedure. Because you didn't follow this kind of template, that's why when you mention quite fast and you may miss out some important points. So pre-procedure, some blood tests will be checked to make sure that you are fit for procedure. And this procedure generally will do it until the ultrasound guidance to make sure that, I mean, you can mention safety triangle, but actually by definition, all the procedure must be image guided, or cannot be just blind technique. You can mention that this procedure will be done under the ultrasound scan, okay? To make sure that, or you want to mention jelly scan also, okay? But usually I think ultrasound is not a jargon. You can just mention ultrasound scan to guide us where to insert, and we will perform by an experienced doctor. And yes, I mean the details you can simplify it. And I feel it's, if possible, try to avoid the term local anesthesia, because anesthesia is again another medical term. You can say that you can give some local painkillers will be injected.
Okay.
It's safer to mention local painkiller instead of local anesthesia. Will be injected over the skin to numb the particular area. It may sting a bit, but usually it does not last long. And then a small cut will be made, and the drain will be inserted gently into the chest cavity. And if you feel a bit very painful, we may need to top up your pain medication. But generally, you may feel some pressure or some pushing kind of sensation. After the drain is placed, we will stitch you out, just one or two sutures, and we will cover with a dressing. And then this drain, yes, we will connect to a bottle with a water level, in which if it shows bubbling, it shows it's functioning. And the procedure usually lasts about 1 hour, if the patient asks. And post-procedure, we need to monitor you, repeat the x-ray to reassess your lung, and make sure the tube is inserted correctly. And the drain, we need to monitor regularly to make sure it's functioning. And usually it will be placed for a few days, 3 to 5 days. You want to mention a cut-off also, okay? And it will generally be removed once your lung has fully expanded and the tube has served no more purpose. And you need to mention straight to the wrist. You mentioned about pain, you mentioned about bleeding, but you did not mention about infection and injury to the surrounding organ, including the heart. Especially this is the left side, right? So it's also important. And every procedure we always forgot to mention something about failed procedure itself. Just like renal biopsy, we need to always counsel that there is a chance that we may need to redo the biopsy, the sampling of the tissue again if it's failed, or if the tissue that we obtain is not adequate. So same goes to this chest tube insertion. There is a risk that the tube may fall off or fail to work and may require reinsertion. Okay, so this is something that we need to mention to them as well. Yeah, infection is something commonly we should mention: pain, bleeding, infection, injury to surrounding organ, and the precaution you need to tell, because the patient asks you a concern. Is there anything I need to be taken care of? I need to be aware. You say no. Generally, we will monitor you. But there is something that they need to observe also. You must say that, you make sure that the drain must be below your chest level, because cannot be above, right? Above, then the air will go the opposite direction. Must be kept below your chest level, and you must make sure that the tube is not kink or tangled as you sit on the bed, and you should really try avoid accidentally pulling or tipping on the bottle. Okay, so that is something that patient need to be aware as a precaution. And then yes, you need to mention about consent. Okay, because you didn't mention about consent. Basically, for this scenario, I decided to ask, so do I need to sign anything? So after the precaution, risk, everything, you should automatically mention about consent before you ask about consent. Is to say that, okay, so if you understand this, I will give you all these documents that you can sign, and then you can think about it. But generally, we need to do it urgently. I hope you understand. And may I know what is your idea at this point of time? If the patient say yes, okay, do you have any other concern? And then if you left with 10 seconds, you can mention that, okay, thank you for our conversation today. I will pass you some leaflet brochures website regarding this procedure called chest tube insertion. And if you have any question, please come back to me before we perform the procedure. Thank you. And that 10
Okay.
seconds is
Okay.
enough, but you just need to practice a bit more and just need to have your own template. If you follow this approach, actually you won't feel panic because you will allocate a bit of time. You know that for this procedure outside, when you prepare the scenario, patient has 6 sinus and therefore just done the pacemaker and suffer from complication with pneumothorax. So you must mention that uh, this pacemaker is indicated for his condition. If not, his condition may get worse. Okay, and therefore the risk is actually less compared to the benefit. Unfortunately, even in experienced hand, it developed pneumothorax, which is the air leaking of the lung, and then subsequently, oxygen has been given. However, need to put in the chest tube. So you go one by one. You classify like this. You explain one by one. Generally, if you allocate like this, probably at each component you only needs about 1 or 2 minutes. So roughly until the pre-procedure, procedure, post-procedure, usually I think you will spend about maybe 7 minutes, 6 to 7 minutes, and then you spend the remaining 1 or 2 minutes talk about precaution, consent, and also addressing concern. If got time, you talk about social part, but I think it's generally quite tight lah. I hope that they won't expect because until now RCP haven't come up with any sample scenario for 10 minutes com skill station. But generally what they have mentioned is they will not change any of the scenario. I mean, the variation of the case is still the same, just the timing itself. Okay, so we would predict that they are expecting the same thing, but with a shorter time. Okay, I hope that they may not give scenario like this, which is a combination of 2 components. Explain about complication from procedure at the same time explain about the procedure. Just same goes to the first scenario also is a bit complicated because it's actually a complication of procedure followed by refusal of procedure. Okay, so but generally if you prepare you continuously prepare the com skill intermittently with friends and colleagues, you will feel okay one. Just need some time to
Okay.
talk. And because if you're not used to talk, suddenly you need to talk like a very professional manner, you will feel a bit stuck. And that's what you experience just now. You feel a bit stuck when you talk about this thing, pneumothorax, you talk about complication and management. So you when you write the scenario outside, you have to write something like that. Okay, I want to explain about pacemaker, benefit more than complication. And pneumothorax, you just put maybe just write define, symptom, complication, and management. And then chest tube, what is the indication? And then pre-procedure, procedure, post-procedure. And then you mention risk precaution, and then you mention about consent and concern. And then you put a summary. Probably that is what I will write outside for the 5 minutes. Okay. So if
Okay.
you write like that, just like a rangka karangan, just like a framework of your consultation, then you should be okay. You follow your own approach, then you should be fine. Okay.
Okay. Okay. Sure.
Mm.
Thank
So
you.
anyone
Thank
have
you.
any question before we proceed? Thank you. Anyone have any
No
question? If
question.
not, we will proceed now. So next candidate, we will proceed with Dr. Wong first. Dr. Wong, are you there? Dr. Wong? If Dr. Wong not
Yes.
there, yeah,
Yes,
yeah.
yes.
Wong, you're here already, right? Okay, okay.
Yeah.
Okay, are you ready? So we will give you 5 minutes to prepare the third scenario. You are ready, right? Hello, Dr. Wong? Yeah. Can you reply? Can you unmute yourself and reply if you are ready?
Yes, yes.
Okay. So we'll give you 5 minutes. Your time start. Wait, let me just set my timer. Okay, your time start now. Okay, time's up. Dr. Wong, this is the patient, Mr. Azizan. You can start.
Hi, good afternoon. I'm Dr. Wong, one of the registrars in the heart ward, in our cardiology ward today. Can I confirm your name and age, please? Am I speaking to Mr. Azizan, 45 years old?
Yeah, I'm Azizan, 45.
Yeah, Mr. Azizan, before I proceed, would you have any expectation of today's consultation? Do you have any expectation? Yeah.
Expectation as in?
As in, how do you understand about your condition and why do you admitted for what? And
Yeah. I was told by a doctor that I have irregular heartbeats, and I come to hospital because my heart beats very fast. I feel racing of heartbeat, and I was told that this is a condition called atrial fibrillation.
Yes, you're absolutely right. So, Mr. Azizan, now you are well, and actually we are planning to discharge you soon. But before you discharge, actually my consultant would like me to talk to you about a new treatment that actually we would like to start on you for your condition called atrial fibrillation. All right. So
Oh, okay.
as you mentioned, so before I proceed further, do you need any more explanation about your condition? As you mentioned, irregular heart rhythm that you mentioned to me just now, do you need any more clarification or explanation on that?
Yeah, doctor. I was told that this atrial fibrillation can actually cause stroke. Is it correct?
Yes, you are correct. Yeah, Mr. Azizan, what you understand is actually correct. Atrial fibrillation, as what you understand, is actually some irregular beating of your heart. And if let's say there is multiple, if let's say this problem is persistent, that it can cause stroke, as what you mentioned, in the long term. And that's why we need to target and treat this irregular rhythm, what we call as atrial fibrillation.
Oh, okay. So you say you want to start me on new treatment. What is that, doctor?
Yes. So basically, for atrial fibrillation, we do have standard treatment of blood thinners that we use for stroke prevention. But now, actually, our center is being recruited as a clinical trial study for a new medication for stroke prevention in an atrial fibrillation patient.
Oh,
So
does it mean that a medication to test on human subject?
yes, you are correct, Mr. Azizan. This is
Oh,
what we
that
call.
sounds scary, doctor.
But before I proceed and before you commit, would you mind if I explain to you what is a clinical trial about?
Sure, doctor.
Yeah, so clinical trial is actually a study that uses, of course, human for doctors to understand about illness and about how the efficacy of medication use. And in this case, we are using a new blood thinners called as asundexian, which might be helpful in atrial fibrillation patient. And for this, as I mentioned, that it might be helpful. It helps the doctors to plan and to further research on what is the outcome of this new medication. Would it be okay to be marketed and also to be helpful to the mankind in the future? So this is the purpose of clinical trial. Do you get me?
Yeah, doctor, do you mean that I will definitely receive the new medication?
Yes. Unfortunately, I do not know which because this study is a blinded study. That means that I will not know which, if let's say you are recruited in this study, I will not know whether you will receive this new medication or you will still receive the standard blood thinners for your atrial fibrillation. So even we as investigators, we will be blinded and we will not know which arm we are being enrolled in. So, but that's the purpose of this study, so that we will know which will bring the best benefit, either with the direct, with the usual, with the standard medication, or with this new medication will bring benefit in the long run, which could help you and other patients in the future. Do you get me?
Okay, doctor.
Yeah. So, but of course, having said that, even though you are enrolled in, as I mentioned, that I cannot guarantee you will be using this new medication, as you might be in the control arm with the standard direct blood thinners that I've mentioned. But having said that, if you are enrolled in this study, as I mentioned, that it will be very beneficial for future medical life, and also not for you, but also to other patients. Please be aware that if you are started on this new medication, sometimes it will bring benefit to you. It can treat your stroke prevention. It can bring stroke prevention to you. But at the same time, it might have no effect at all, or it might even be worse. There's
Oh
something that
no.
you should expect.
Then doctor, what is the benefit of I enrolling in this trial, doctor? Is
Yeah,
there any
so
benefit for me?
the benefit actually is more like for us to further research and also to further explore new advances in medical new pharmacological products to advance our medical career and also to help you and also future patients with atrial fibrillation. That would be the best novel thing that I could ever think of for a patient to be agreed to enroll in a clinical trial.
But doctor, if I get sick, I'm on this medication which I don't know which one I'm on. Will I get any free treatment or anything?
Absolutely, your concern is absolutely correct, Mr. Azizan. If let's say you are enrolled in this study, you will be followed up regularly based on what our clinical trials have mapped out. We will we will be following you up on all the following updates that you must be compliant to that. And you must also be compliant to all these medications that we have started on you, regardless of whether you are on the control arm or you're on this new medication. But if let's say you have developed any side effects, we will always give you our number, our investigator number and investigator our investigator staff numbers that you do not hesitate to come back to us, and we will arrange as soon as possible meet up to you, and you can address all your concerns and complaints to us, and we will be there to help you.
Doctor, is this drug safe? Is it any animal study that was done before testing on our human like me?
Yeah, Mr. Assistant, just to let you know, this study actually has come to a stage of phase 3 study. So having said that, phase 3 study, that means it is safe to be used on humankind already. So we have passed, just for your information, we have passed through phase 1 and phase 2, as you said. We have passed through the animal study, we have passed through side effect study, the phase 2 study. So now we are moving forward to phase 3 study, which is deemed safe for now. But now it's more like for us to study how effective is this medication compared to the standard treatment. So for that, I can rest assure you on that. But if let's say you really develop any side effect that you feel like you are not you feel that you are not on track, you do not hesitate to get back to us with our specialist call investigators number that we will issue to you towards the end of the conversation.
Then doctor, is there any chance that I may know what medication I'm on if I'm very, very sick? Like I go to other hospital, will I ever know what medication I'm on? Whether this is a new medication or the standard medication?
Okay, sure. If let's say you fall sick and fall ill again, please do not come back. Please do not hesitate to come back to us rather than going to other hospitals, because we are totally in charge of your health once you are enrolled in this clinical trial. So we will treat you based on whatever symptoms that you have, based on our investigation, and again, as I told you, I do not know what medication you are on once you are
2 minutes left.
All the investigators are all blinded. So in that sense, if let's say you have any serious side effects that warrants admission, I as a core investigator have the rights to withdraw you from these clinical trials because you are not deemed safe to further continue this trial. So you can be rest assured on that. Yeah.
So meaning to say I can leave the study anytime I want?
Absolutely. And you can leave the study anytime you want in case you feel you are not right. And even us as investigator, if we think that you are not safe to further continue, we have the rights to stop your clinical trial.
Oh, okay. And will my personal details leak to the public because I'm reviewing all my medical condition to this trial?
Yes, clinical trial is something very confidential. So if let's say you are recruited, you will be having a special code inside our study, and your data is definitely confidential. Is only known between the investigator and the investigator, and also the drug company and also drug reps. This is and it will not be leaked to any third party.
Wait, doctor, my details will be known to the drug company?
Sorry, it will not. Okay, so everything of your data will be coded, and also that this will only be your data will only be among the investigator. Yeah, so sorry for that. Yeah.
Okay. Then how should I proceed if I came for this study?
So if you are keen for this study, I will definitely let you to go through I'll give you all the brochures, pamphlets, and about these investigator products, pamphlets about Asundexian that I just mentioned to you. And you can take all your time to read about it and also discuss with your family members and all. And we can always schedule you for another meeting if, let's say, you are keen to proceed with this study. Would it be okay?
Okay, doctor.
Yeah. So do you have any more questions for me?
No. Okay, time's up.
Okay.
Okay, how do you feel?
Difficult.
What was your impression when you look at this scenario?
Impression.
Shock?
Shock.
Shock, right? Shock.
Mm.
So bear in mind that clinical trial kind of scenario can appear in exam, can really appear in exam. But regardless of what kind of scenario, what kind of drugs, what kind of what kind of design of the study, if you follow a same approach, actually all the clinical trial scenario is almost the same lah, huh? So I think you'll do quite well. There's some points that maybe need a bit of clarification as well. We will go through. But generally, how do you think you do?
Okay, just okay.
Okay lah. So regarding the information privacy confidentiality part, right? You mentioned wrongly that the patient information will be revealed also to the drug company. Is that so?
I think it's not such. I think everything will be coded and only among the investigator who know.
Yeah. So in GCP, there is something called sponsor, which is a drug company. There's something called investigators, be it a principal or co-investigator. And there's also something called regulatory authorities, which is our MPRA or the drug authorities like FDA internationally, or even the ethical committee. Okay. So there's this four body, and this four body generally is a circle, and the center is actually the patient. Okay. So only the investigator actually holds the patient privacy, the patient clinical data, or what we call as principal data. Okay, the principal data is what all the things, for example, X-ray, ECG, the lab result, everything. And then what the principal investigator do, or regardless of principal or co-investigator, what they do is actually to translate all the principal data or the essential documents into the identifier, the so-called the questionnaire, which is the EM. There's something special name about this, unique identifier code with a proper the survey from CRF, we call it. It's a CRF, okay? It's a data collection form basically. So the company can get access to the CRF, but the CRF will not mention patient name, will not mention about patient medical condition or anything. They will just collect the essential data, and the patient will be labeled as a coding system. Okay, so the drug company will never know lah. Oh, so this is the way to ensure that when you explain to the family, the patient itself, the drug company will not know about your condition. Basically, everyone will not know other than the committee. Okay, and probably if we go through this scenario, it's a bit scary, right? Even if, to be honest, when I prepare this scenario for any one of you, if I'm imagining myself that if I got this scenario in my exam, I will also be quite scared, because this is something quite new and it's not something that regularly being practiced in any of our setting when we go for exam. But unfortunately, it's kind of scenario that we need to know. And I still remember back in Batu Pahat mock last year when I went for it, they also come up with something similar. Not this trial, not this drug, different style, but they are also discussing a clinical trial. Okay, so the key point is that clinical trial is something possible that can come out in exam, and because nothing much to discuss, you just need to follow the template very well. But if you first time practicing this, then definitely you will feel very, very anxious. Okay, so I'm going to go through this. I think you score quite well. I think generally, like you say, you do well. And later I will go through a bit of the information that maybe you need to clarify a bit. So regardless of what trial, we need to really read through the stem properly. This is an international multi-centered. So you need to basically explain about trial, right? Your role is to explain about trial. You need to mention that this is international trial involving multiple center. You didn't mention about that, right? And you need to mention that it's randomized, so-called randomized. You don't have to mention randomized. You say that we will collect all the patients that fulfill, that have this similar condition like you, and we will randomly allocate to either the new drugs or the current standard medication, blood thinners. Okay, And you need to mention about what it means by double blind. Yes, you mentioned that blind, but actually it's not necessary to mention blinding in front of patient. You can mention in a simpler layman's term that basically this is carried out in a strict confidentiality. We will not know, and patient also will not know what medication that you are on. It can be either two of this, and essentially we will never review until the end of our study as well. And you have to also explain about what you mean by phase 3. Okay. So phase 3 means to say that already passed phase 1 and phase 2, like you say. But actually, phase 1 and phase 2 doesn't mean animal study. Okay, animal study is animal study. This phase 1, phase 2, phase 3 is already considered a human study. Basically, phase 1 is to identify the phase 1 is to identify that there's actually pre-phase 1 or phase 0. Phase 0 is the so-called pilot study. Phase 1 is basically to identify the pharmacokinetic aspect of the drugs, okay? The pharmacokinetics, PKPD, okay? And phase 2 is mainly to decide what are the doses that is safe in humans. So it's mainly talk about safety and efficacy in terms of phase 2. But phase 3 actually explore on the benefit and the risk. So the must really explore what is the new medication is beneficial, and what are the other possible risks that the patient may have. Okay, so this is phase 3, and phase 4 is the post-marketing trial, which to explore how does this really benefit in the long run. But phase 3 is something, the main important idea is to study the drugs benefit versus risk. At the same time, also need to know whether, I mean, it's all primary and secondary objective, all those things, but essentially it means to study whether it carries risk more than harm or harm more than risk. This is the phase 3. And novel agent, new agent, yes, whatever drug it is, just mention. But you can choose not to mention as well. It's a new drug. You don't need to mention the name. It's also okay. And yes, so to simplify, how do we discuss any clinical trial kind of scenario? So yes, you have queried done well. You started with inviting him to take part in a drug study. But before that, also important to actually mention about confidentiality and exploring the patient idea. What have you understand about your health conditions so far? Because we also need to mention that actually back again to this complicated scenario, the patient have atrial fibrillation. Has the patient understand what is meant by atrial fibrillation? Okay, so you need to explore that. And if the patient does not understand, you need to mention that atrial fibrillation is the irregular heartbeats, which may actually cause small blood clots to form, and that can actually goes up to the circulation of the brain, which actually a lot of small vessels in the brain, and that can actually lead to stroke. Okay, so and you explain the aim of this study is to compare the new generation under the so-called the investigational product or trial, the drug trial, compared to the pre-existing one in the market. Okay, so you need to talk about. So when you mention about clinical trial, like it's always good that what we usually do in their big title in any study. First, you talk about background. Second, you talk about aim. Third, you talk about method. Method is the one that you need to highlight a bit more. So you must mention that there's two arms. You will be either given experimental medication or the pre-existing one, and it's randomized. It will be randomly assigned to the patient using the computer system. Both the patient and the doctors, including investigator, will not know which one. Okay, and involve multi-center. Other patients with a similar condition across different hospital, different country will also be joining in for this study, not you alone. And this is a study to gather additional information to evaluate whether its benefit outweigh the risk, and knowing that it's already proven to be safe and effective, because we know that phase 2 is a safety and efficacy study. Okay, phase 3 is just to know whether the benefit actually more compared to the harm. Okay, then you also need to mention about ethical part. The study is actually approved from the ethical committee, and there's regulatory authority to safeguard to make sure that your details are protected and remain confidential. If you don't mention that, then definitely the surrogate will actually ask you, is my data, is my information will be safe if I reveal that out during the study. Okay, but before they ask that, if you explain about ethical and the monitoring and the confidentiality part, then it's also good. It's quite smooth. Okay, then you need to talk about benefit and harm. You mentioned about patient benefit is very authorious. Basically, patient involvement in the drug study is just to help everyone. Okay, but actually that is something that you can mention that can maybe the patient will feel beneficial as well. First is the close monitoring, because patient will be started on this medication the patient will be closely monitored more frequently than usual with series of blood scan and also tests. Okay. And in terms of the health, what are the possible benefits? It's also possible that your health condition may improve, although we cannot guarantee. But it will be useful if this medication could help other people with similar condition later, like you have mentioned. And financially, it's also quite important to mention that you will not be charged for taking part in this study. All the expenses during the treatment duration will be covered. So this is also a reassuring point. Okay. And if you are unwell, develop any sickness during the trial, you'll be treated in the usual appropriate way. You need to mention about this because not everyone knows what will happen after they get unwell. Okay. And in terms of the harm, you need to highlight the fact about side effect. This is a blood thinners, definitely. You may encounter bleeding or others as be documented. However, serious side effects are usually rare and it has already been checked for safety in stages. Meaning to say, any drug that passed through the stage 2 should already screen for all the life-threatening complication. No? And it's quite rare to have, but still possible. However, unwanted and unexpected side effect can also occur. Therefore, we need to regularly monitor you. And all this will be reported and investigated if it's related, okay, to the medication. And you will be regularly followed up. And another important aspect is also the GP and the treating doctor. We need to mention about that. We will also inform your treating or GP about your involvement into this study. And we can also arrange next meeting if you want to know more information, contact number. Yes, I think you mentioned all that, which is good. And there's also a question raised out by the surrogate just now, in which will the patient ever know what are the medication the patient took? The answer is the patient will never know. However, the treating doctor, regardless of which hospital, if for medical reason in the event of life-threatening situation or very serious event, then the disclosure can be made. However, this thing will be informed, okay? And please best be assured that your health is our first priority. You should mention that as well. Health is the first priority, and we will make sure that you are safe. And we may need to stop the medication in the event of all these complication. Okay. And next is actually to mention about the informed consent. You said you must mention that I hope you understand all the information we discussed, and you must be volunteer yourself, must be voluntary to take part in this study. You have the right to withdraw, like you mentioned, at any point of time. But the point is to keep us informed. Okay, you cannot just withdraw anytime, but need to inform because need to follow up. If the patient withdraw, some patient may lost to follow up, and patient may develop some complication, which is a slightly long-term complication from that particular investigation drug, then it's going to be in trouble. So therefore, it's important for us that regardless of if the patient want to withdraw, yes, you can withdraw, choose to withdraw at any point of time, but please keep us informed so that we can still follow you up if you have any issue. Okay. So the concern, I think you explained most of it, and the summary and recap. Okay, generally you did quite okay, no? Quite well. You have any question, Dr. Wong?
No, thank you. Thank you.
Okay, right. So just a bit on the GCP part. I think those that attend GCP will know that some principle regarding the clinical trial. So the clinical trial go through quite a significant hurdle and the history based on our human all the human history. So first started off in Nazi that was, all the during the World War II, the Nazi being the guinea pigs and being a subject of any drug trials without their consent. Okay. So that's why during that time, actually there is new rules that come out that the first criteria is patient must be consented. Okay. Patient must so the consent that we know what we call as informed consent. Okay. So the informed consent is something is important. And subsequently, after patient consented, the patient may not know about the risk and side effect. So the second sad incident that happened in the human history was the thalidomide exposure. Okay, thalidomide was a very good sleeping drug being promoted at that point of time. Everyone consented to take the medication. Unfortunately, no one knows that this medication will cause thalidophoric those deformity over the fetus, and it's very, very disaster. And therefore, that time, another rules came up. Don't need to know the rules like the Helsinki and all those things. Don't need to know about all that. But we need to know that this rule came because certain principle is involved. Because of this thalidomide incident, the all the clinical trial and the study must always check for safety and efficacy. Okay, and until the Geneva, the Declaration of the Declaration of Helsinki, the subsequent agreement by the country, it also mentioned that patient health should be the first priority. And for that reason, a clinical trial should only continue if it is proven to be beneficial more than harm. So that's the main idea of the clinical trial. So we were expected to convey this kind of message when we counsel on the any form of clinical trial. Okay, but generally, if you go through the approach, it's not difficult. You just write only, okay, background, aim, method, just explain what was written outside in a layman's term, and then also highlight on the ethical part, and then you mention about risk and benefit, and the follow up as well as disclosure and the consent. That's all. Actually, it's essentially just these few components. If you go through this checklist one by one, usually it's quite smooth, and usually the time is enough. Okay, all right. If no one has any question, we will proceed to the fourth candidate. Wait, I got one question. Hi, Doctor. If patient asks how the clinical trial lasts, how long can the clinical trial last? Okay, a very good question, because it's not written in the scenario outside. We will never know how long, right? So you will say that regarding the duration, it will be documented, and sometimes it's a bit difficult to decide the duration. And basically, the question is how long will a clinical trial lasted? The question in general, after all the data interpretation and analysis shows that and able to achieve the outcome, primary and secondary outcome that they are investigating, then you can terminate the trial. Okay. So how to convey this message to the patient? You have mentioned that usually the clinical trial will take place for a prolonged duration. However, we will keep the patient updated from time to time. Okay. You don't have to commit how long because you really don't know. Okay. Unfortunately, at this point in time, it's quite difficult for us to gauge how long can the study been. But usually, any clinical trial will end after appropriate analysis of the information that we gather from the patient is proven, and then we can end the trial. You can just mention like that. You don't have to mention the duration. Okay. All right. So yeah, if the patient says they want to be on the real medication rather than placebo. Yeah. So this is a question also I tried to prompt Dr. Wong just now. I said that can I take the new medication? I don't want the current standard medication. Can I just take the real medication? He said unfortunately cannot. This is a study in which we need to make sure that there is no any form of bias to patient that we choose. All the patient will be randomly assigned to any one of the drug. Unfortunately, as an investigation myself, I will never know what medication you'll be assigned to. However, please rest be assured that this study is being carried out at your best interest, at the best interest to investigate whether there's any benefit compared to the standard medication. You can mention that. I mean, you don't have to agree to disagree for the patient. You just mention that unfortunately I cannot promise you. There's 50% chance that you may get the pre-existing medication. There's also a 50% chance that you will get the new medication. Regardless of which medication you get, your health is the first priority. You see, now the important thing is to highlight all the facts and important point about this clinical trial, right? Regardless of what medication, I mean, whether it's beneficial, whether it's not beneficial, your health is still our main priority, okay? And our focus should always be you. And we hope that this new medication can help. And even if, let's say patient is not convinced, patient still want to take a new medication, what can you tell the patient is that even if you take the standard medication, you are also very helpful in this study because you will actually give a comparison whether the new medication will be more beneficial or equally beneficial as the pre-existing medication. Regardless of which arm you are involved in, you will definitely help a lot in the study. Okay. So at the end of the study, no, ideally for any clinical trial, we should never tell the patient which arm the patient was on. Okay. So the principle of study is, I mean, this is a blinded, double-blind study. The patient will never know for the rest of their life. Even after the drug trial ended, they will never know. Because the principle of the study is really double-blind. Okay. So you should mention that if the patient asks like that, you say no. Unfortunately, you will never know what medication you are on. Okay, and all these things will not be disclosed. unless you have suffered a really life-threatening situation, or due to medical reason, that this condition, I mean, this medication that you are on will be reviewed to your treating doctor, but unfortunately not to you as well. Okay, so that's the idea of this discussion. Okay, so next one is we'll go to Dr. Benjamin. Dr. Benjamin, are you there?
Yes, I'm here. Can you hear me?
Yeah, good, good. Yeah, your voice is clear. Okay, so
Sure.
I will give you 5 minutes to prepare, and after 5 minutes we will start. Is it okay?
Right, that's fine.
Okay, let's start.
Thank you.
Start. Okay, time's up, Dr. Benjamin. So this is
Right.
the patient, Mr. Albert. Please start.
All right. Hi. Good afternoon. My name is Dr. Ben. I'm one of the doctors here today, here in the hematology clinic. May I confirm if you're Mr. Albert, 25 years old?
Yeah, I'm Albert and 25 this year.
All right, sure. Hi, Mr. Albert. I've been asked today just to talk to you about your condition and also to talk to you about an option that we have for treatment. Before I start, can I ask a bit about what you understand about your condition so far?
Yeah, doctor. I have thalassemia since young and always under this blood clinic follow up. So in one of the clinic I was seen by your consultant, and I became more frequent transfusion dependent in the sense that I almost require transfusion about every 4 to 6 weeks. As compared to now, I require about 3 to 4 weeks. And your consultant had told me that previously if my iron level in the blood is persistently high, I may need a medication to control it. I'm keen to know further about this, doctor.
All right, sure. So yes, you're very right. You're along the right lines. Today, I've actually been asked to talk to you a bit about your condition, which is beta thalassemia intermedia. So I'll tell you a bit about what's been going on. So as you understand rightly, your red blood cells, which are the cells in your body that carry oxygen, are abnormal. And this is something which has been present since birth due to a problem in forming the red cell. So because of its abnormal shape, it is unable to carry oxygen properly in the body, and that's the reason why you need blood cell transfusions, which are obtained from other people. Unfortunately, as you very well mentioned, now that you have required blood cell transfusions more and more frequently, this has actually caused an issue because based on our monitoring of your blood tests, your level of iron in your blood has actually remained persistently high. And the reason for this is because our red cells in our body contain iron. And as the red cells are broken down, the iron is therefore, it goes to many places in the body and they stay there. So the medication that we've been, sorry, sir?
Oh,
So the
sorry. What will
yeah.
happen if all the iron start to store in other parts of my body?
All right, I'm glad you've asked that. Now, the issue is that too much iron in the body is not a good thing, unfortunately, and it causes many issues because they tend to stick in places that they're not supposed to be. So they tend to cause issues, for instance, with the liver. They'll cause liver problems, which causes a rise in the level of toxin in your body. They cause problems also with control of your blood sugar, and they can lead to a condition called diabetes. The high level of iron can also go into your skin and cause darkening of your skin as well. They can also cause issues with clotting of your blood because of their effect on the liver. They can also cause issues with the kidneys as well as with your nerves. So it is something that we want to try and avoid, sir.
Okay, all right.
Right. So are you with me so far? Are you okay so far?
Yeah, doctor.
All right, sure. So that brings us to the reason why I've come to speak to you today. We plan actually today to start you on a new medication, which is called desferrioxamine. Don't worry about the term. I'll explain a bit about what it does.
Okay.
So what desferrioxamine does is it helps to bind the iron that's in your body, the iron that's currently in oversupply, and help to bring it down in the blood so that it doesn't stick to places in the body where it doesn't belong, and it avoids all of the problems that I've previously mentioned. Are you okay with me so far?
Yeah.
All right, sure. So desferrioxamine is a medication that we give by subcutaneous injection, which means we give an injection underneath the skin. And this medication will then work as previously mentioned, and it will help as well to reduce the iron level in the blood and also help to avoid the problems that are previously mentioned. Up to
Doctor,
this point, do you have any questions? Yeah.
yeah, when I go to the thalassemia clinic previously, I saw some
Mhm.
patient on probably on such medication as well. I saw they are also on this infusion pump. How long generally I need to be on this medication when this medication is put under my skin?
All right. Well, this medication will have to be on you at least until we can bring down the level of iron in your body down to a satisfactory level. Because this medication will take some time to work, and it is also a medication that has to be given continuously, which means that it has to come to a point where we will be monitoring you regularly and frequently in order to make sure that the medication is working. And at the same time, we will also be checking you out to make sure that you are not suffering from any of the effects of oversupply of iron that I've previously mentioned.
Do I need to take this medication every day?
This is a medication that we will have to give you regularly, but it is a medication that we will space it out. It may not necessarily be every day, but for this, I'm afraid I will consult and I'll get back to you.
Sure. Okay.
All right.
And is there anything that I need to be aware if I'm this medication?
Okay, now as with any medication that we start, there is, of course, a risk of a small but definitely a mentionable risk of developing allergy. So we will be monitoring you for any possible allergic reaction. This can include things like rashes on your skin over the area where they've injected, to rashes that go over your body a bit more widespread, and maybe feelings of feeling like your body temperature is higher than normal, feeling like you're sweating, or maybe having feelings that your heart is beating quickly. In particularly more severe but thankfully a bit rarer conditions, you may also develop problems with breathing as well. Now, not to worry, we do monitor for these conditions and we will, of course, keep an eye on you. We will also be monitoring your blood results in order to make sure that you don't have any reaction that also leads to problems with your kidneys or your liver or your blood counts.
Okay. Is that all? Any side effect that I need to be worried?
Well, the other thing with this medication is that the other problem with this medication is also that we need to monitor and make sure that the medication doesn't cause your iron levels to drop too low. So that is something that we will have to monitor for and to keep an eye on your iron counts as well.
If doctor, if I'm having any a loose stool, do I need to continue this? Can I continue this medication?
Oh yes, yes. So, sorry to mention that occasionally you can also, if you do develop any change in your bowel habit and you develop loose stools, for instance, please first of all do inform our clinic, ideally through a hotline number, or if failing that, at least present yourself to the nearest emergency department, as we will have to be made aware of this, and we will have to discontinue your medication until we have a chance to have a closer look at you.
Okay, doctor.
All right. Up to this point, are there any concerns? Are you all first of all, how do you feel about this? About starting this treatment? Are you all right with this?
Yeah, this is very new for me. I feel
Mhm.
I'm willing to try this medication. I am just feeling a bit scared that I need to carry out this infusion pump for quite some time for every day. 2 minutes left.
I see. Can you tell me a bit about your concerns? What in particular are you worried about?
Yeah, I'm worried that this will be lifelong for me because I'm still working and I need to carry this infusion pump with the needle sticking into my skin for quite some time before I can. I'm worried that people will look at me thinking that I'm actually very ill and not suitable to work.
I see, sir. Your concerns are definitely very valid, and that is definitely a very common concern we hear about patients who are on infusion pumps. Now, first of all, an infusion pump is something that you can bring around. There's no reason that you should be limiting your daily activities and moving about with an infusion pump as well. A lot of people, for instance, people who not only have a condition like yours, but have the conditions like type 1 diabetes, for instance, carry infusion pumps along with them, and doesn't really impede their physical activity in any way. Now, of course, having an infusion pump on you can also sometimes cause, maybe might lead to some questions if people do see the infusion pump under your skin. But by and large, it is something that a lot of people do manage well. Sometimes it is actually quite not really that clearly visible under the clothing. And more importantly, it is something that helps, first of all, not only to be beneficial to you in terms of reducing all the problems that I've told you about for iron overload, but at the same time also to help preserve your independence and your ability to carry out your life the way that you see fit. Does that answer your question?
Yeah, sure. Okay, if this medication fail, what would be the next step, doctor?
All right. The next step also is that if let's say that the medication failed, we may then have to possibly extract the blood in order to see whether or not we can bring the iron level down a little bit more quickly. Of course, that is something that we hope we don't have to resort to. But again, that may
Time's
be
up.
of consideration.
Okay,
All
thank
right.
you, Dr. Ben.
Yeah.
Okay. Yeah, how do you feel?
Completely unprepared. I honestly, I'm afraid I just really a black spot. I didn't know anything about desferrioxamine. So
Yeah.
along halfway, I'm afraid.
But
Yeah.
surprisingly, I think you do really well. Your communication is smooth, and very empathic. The way you talk. So without knowing the desferrioxamine itself, you already can score well, lah. Oh? But there's just something that we need to, I mean, just to highlight, lah, just something extra, because I think your comm skill are very good. Huh? You explain in detail, and you also intermittently checking the patient understanding. This is what we should do, especially when you realize that you talk a bit too much. Then you should always take a step back and ask, are you able to get me so far? Do you have any issue? Okay. So how will you think about this? What is your idea about this? This is a very good approach, I would say. Huh? Even though you don't know the desferrioxamine in detail, but if you perform like that for generally for com skill is never about assessing your knowledge per se. It's more to the soft skill part, the component, which I think you did really well. Okay, don't worry, you did well. Okay, so just to highlight a bit lah, but I mean just for the knowledge part. Okay, so yes, you mentioned about iron overload. And yes, you also explained about thalassemia in brief, and therefore require regular transfusion, and because of ineffective production of the red cell, and that actually leads the regular transfusion actually leads to build up excessive iron, which cause harm over the time. And this is what written in the leaflet. That's why I decided to just extract them out in a simplified manner. Our body has no natural way to remove the extra iron, and therefore this iron will deposit in the major organ, like what you say. But the main important organ that you mentioned, yes, liver is one. Diabetes is possible, but the main important thing is the liver and the heart, and therefore it's important for us to check for MRT2 star, right? It's the heart failure and also the cirrhosis, the stiffness,
Lost it.
liver stiffness, and also weakening of the heart, as well as the hormone. Yes, you can mention the proteins, the hormone, especially reduce, as well as can also reduce in terms of your fertility. And yes, you can mention about diabetes and skin problem, no problem. And desfosamine, the way you talk about desfosamine is probably you can, instead of straight jump to the name, you can mention that what is the desfosamine is a form of iron chelator, to remove, and desfosamine is one of such therapy. It's given below the skin, just below the skin, and you should also advise on the location, okay? Just like insulin injection, right? Tummy, thighs, and upper arms. And ideally, patients should also rotate to different sites at different time to avoid any skin changes reaction. And because you didn't you forgotten that actually it's an infusion pump base, you need to mention that actually this below the skin is using a special pump called infuser. So this infuser is something interesting. When I prepare for this scenario, this is also something interesting for me because I never really in charge of thalassemia patient well enough to understand that actually this infuser is actually one-off use. You cannot reuse the infuser, and it's like a cartridge thing. After you finish the infuser, that's it. You need to change for another infuser. Okay, and the infusion usually is given over 8 to 12 hours. And yes, I try to ask you to assess your knowledge in the sense of how frequent you give. I think your answer is very good. You mentioned that may not need daily. It depends on your condition, which is good. If you know that, you can mention that maybe 3 to 7 times depending on your body iron level. And another point is actually if you know, only you mentioned, I don't think they will penalize you to know the details. Infuser should be kept in the fridge about 2 to 8 degrees Celsius. And prior to use, it should be out of fridge for 2 hours. You need to check the label and make sure it's not expired. And then need to separate needle, and then no missing is required, and throw the empty one into the sharp bin. So all those things are the one that, the minor things that you need to make sure patient did not accidentally hurt themselves. And side effect, you mentioned about the local reaction, allergy, yes. Skin changes, irritation, blister, therefore you need to rotate different side. But the two important thing that you need to mention in desfosamine is these two. Therefore, I ask you the question of if develop loose stool, what you should do. You should really attend to the hospital immediately, because we know that this medication may predispose you to acquire certain bug or infection. But generally, usually after you stop the medication for a while, treat you with few days of antibiotic, you can resume back the medication without any issue. At the same time, because you're on this medication, sometimes in a rare occasion, they may cause some ringing in your ears and reduce in your vision. Therefore, we need to check up your eye as well as your hearing annually. So these two are the extra point that I think perhaps if you can improve further, these are the two extra point that you should mention. But you can see that com
All right.
skill is not com skill. You already got a very good communication skill. The only thing left about this station is just a bit of knowledge. So you need to do a bit of read up for certain common medication and certain common condition. You can read the NHS website and the leaflet. So if you go through, you should able to do very well. Oh, very good. You also managed to explore on the social aspect. How does the patient feel about the giving this medication? Generally, because of the stigma, everything, you managed to address that well. And generally, when this medication fail, what's next? Yes, actually, there's no proper answer to this. The answer that I want is actually splenectomy, but I think it's a bit far-fetched to talk about it right now. And I think you did it very well. You say that we need to there are certain ways to, for example, to take out your blood, to reduce the iron level, all those things. You can mention that. I mean, you don't have to mention the single answer thing, which I think generally you did very well. Okay, very good. You got any question?
Well, actually, there's one thing actually for this case that came up to me. When we actually ask about, for instance, the patient's knowledge about the condition, and initially, for instance, the patient's the surrogate already then mentioned much of what we wanted to say, which is that there's too much iron in the blood. They've already had transfusion for quite some time. I decided instead, just to be safe, to just go back to again the basic about discussing the condition and explaining things like from A to Z. Am I using too much time for that, or would
Yeah,
that be
so
a
you
good
can see
approach?
this is a very good question because it's always a dilemma that how brief or how deep we need to discuss a certain condition in which already explained.
Hello? Hello?
Hello? Yeah, I think the line get disconnected. Can everyone hear me now?
Yeah, we got you.
Yeah. Where was I just now before I was suddenly disconnected?
I think we were talking about whether or not it's fine to go back over the basic pathophysiology of the condition first, whether
Oh, yeah.
that's an effective use of time.
Yeah, correct. You spend about 2 minutes to talk about thalassemia as well as iron overload. Then you use another about 1 or 2 minutes to talk about the complication of the chelation, and then you talk the remaining time you use to spend on chelation, which is dextrosamine. I think it's fine, but for this kind of scenario, because patient is a known case of thalassemia since young, and the only thing changed is actually the iron overload. So when the scenario asks us to explain about condition, I will just mention in brief one sentence about thalassemia, but I will focusing more on iron overload, in which I define the iron overload and what are the complications that was encountered, potentially be encountered. And then only then I will address any patient concern, any question before I go into dextrosamine, which is iron chelation. Okay. So but perhaps for your case, perhaps you can cut short a bit of time to mention about thalassemia, but focusing more on iron overload. And then after that you continue as what you have done. Actually, your timing is just nice. Just a summary part, because it's a bit rushed, you didn't manage to summarize that, but it's okay. You can say that probably the only way to summarize this, you can mention that, okay, and the consent, you didn't ask him about consent. So you should tell him that, okay, I explained everything regarding this. You can take time to think about it, and then we can always arrange another session if any question. I will also pass you a leaflet brochure and website about this medication, dextrosamine. If you have any question, you come back to us. Is it okay? Just like that. Just a very concise summary. Okay. Okay, right. So, Eldon, can you hear me?
Yeah, Junmin, hi. Can.
Okay, good. I can hear your voice is clear. So
Okay.
I will. You're ready?
Yeah.
Okay, we will give you 5 minutes for the last scenario. Your time start now.
Oh, nice. Wow. Oh, this.
Okay, time's up, Dr. Alden. This is the patient. This is the surrogate, Mr. Go. Please start.
Hi, good morning, Mr. Goh. I'm Dr. Eldon here. I'm one of the doctors in the neurology ward. May I confirm that you're Mr. Goh? You are 30 years old and you are the son of Mr. Edmund.
Yeah. I'm Go. My father is Edmund.
Okay, hi. I was being brought to you today to just talk to you about your father's condition. So before we start, just want to know your understanding a bit about your father. May I know what do you know about him at his condition now?
Yeah. From my understanding, my father was unwell at home about 1 week already, and he told me that he become very irritable. He also has some very stiff over his neck, and he seems to avoid any lights that come into his eyes. And I know that in emergency department when we bring him to the hospital, he had underwent some sampling of the brain fluid, and today I'm being called here to know about his condition.
Okay, so before we start further, is there anyone else you like to be in the room today to explain together?
No.
Okay, so yes, you're right, Mr. Goff. So your father has basically a disease called meningitis. Okay, it's basically an inflammation of the layer surrounding the brain, which resulted him having these kind of symptoms. All right. Do you have any questions so far?
Oh, is it dangerous?
If it's being treated and detected earlier, he'll recover fully. So basically, he at this moment we have done something called to take some fluid from the bag to test for what kind of organism is this. So it has came out and we have confirmed the diagnosis of this inflammation of the brain layer, and we need to admit him to our isolation ward, and we need to start immediate antibiotics through the line through his veins. All right.
Why, doctor? Why he needs isolation, doctor?
Okay. Okay. This disease, it's very it's how to say, this disease, it's contagious, meaning that if we put Mr. Edmund out in the open ward with other patients, we are afraid that other patients will contact the disease as well. So it's for the best interest of the patient, and it's also for the best interest of other people that we are managing him in the isolation ward to prevent the spread of the disease.
Oh, okay, doctor. What is the cause of this infection the infection in the brain?
Okay, it's basically caused by a bacterial infection. The name is called Neisseria. Don't bother about the name. It's basically a common pathogen acquired from from a dirty source, which a father might have picked up, probably from during some traveling or from other places that he has this condition. So I want to ask further, how was he during before he had this condition? Did he travel anywhere or?
No. He doesn't travel nowadays. He's only staying in the nursing home, doctor. But I think 2 weeks ago,
Hmm.
my relative actually came and visit him in the nursing home.
I see, I see. Was your relative unwell that time?
No.
Okay, okay. So yes, indeed, nursing home, in the environment, it's a place where this type of disease, they are easily spread to, among the tenants in the nursing home. So it's good that Mr. Edmund was diagnosed well, and I mean earlier, and also was diagnosed so that prompt treatment can be started. And I'm sure that we'll be giving him the best treatment available here, and he'll be under our good care of our ward staff and myself.
Doctor, what is the outlook of this infection? You mentioned that it can be serious, right? But what is the outlook, doctor?
So if this disease is left untreated, the patient might have developed some neurological disability, meaning some disability caused from the brain system, which can cause some muscle weakness in long term, or causes some difficulty in swallowing or speaking, or to be more serious, this disease, if it's not treated, it can be life threatening as well. So yes, before I want to ask, have you yourself, or any other family members, is there anyone who has come into contact with Mr. Edmund recently?
Yeah. We actually every day also we visit him one.
Okay, sure. So as for the contact, we call it contact precaution. So for you and your siblings or your other relatives who has in contact with him, we will need to get all of you to our hospital or clinics immediately, and we will start something called prevention of developing this disease. Basically, so far, do you understand? Any questions so far?
Do you mean you want to start me on some medication to prevent this infection to spread to us?
Yes, correct. Yes, correct. Because as I mentioned, this disease is highly infectious. So in order to reduce the transmission rate among the family members, or also the nursing home contacts, you'll need to start some tablet kind of antibiotics. It's just one dose, and we'll monitor you all from there.
Okay. And you mentioned that this disease can be cured, right?
Yes, it can be cured.
And how long he's going to receive the antibiotic?
Okay, so good question, Mr. Egor. So he'll be in our isolation ward for the first few days first. So for this disease, we'll need to give him antibiotics through the line for around 1 to 2 weeks, depending on his condition. Okay. And so when you all have to come and visit him in the ward, you all have to practice good hand hygiene. You have to wear contact precautions such as aprons, which our ward will provide you, so that the risk of transmission of this infection will be reduced.
Doctor, that means that throughout this 1 or 2 weeks, we need to wear all this when we come and see him?
Yes, for the first 2 weeks, definitely yes. So at home, when he's being discharged, if he's well, he's being discharged. I would definitely advise continue to advise good hand hygiene as well. However, for this apron, call it protective personal equipments, I think there's no need for that anymore. But the hand hygiene, the good contact precaution, still need to follow.
I see. So he needs to be isolated throughout his stay in the hospital?
As I mentioned just now, during the first few days, once his clinical condition is better, his fever is settled, and he's start to show some improvement, then we'll move him out to the normal ward.
Doctor, I heard that this kind of brain infection can be very severe. What are the possible long-term things that we need to be aware later on? Any
Okay.
long-term side effect?
Yes. So we will after the treatment, and let's say Mr. Edmund is well and he's being discharged, we'll see him back in our clinic at the earliest date possible, probably in 1 to 2 weeks time, to look out for any complications. For example, to see that does he have any his muscle power, or his function,
2 minutes left.
hand functions, or all his swallowing, his basic functions. Are they okay? Have they recovered to normal or not?
Okay.
Okay. Do you have any other questions for me to address, Mr. Go?
So, doctor, you have mentioned that all of us that in contact with him need to take some antibiotic, or probably just one type of medication for 1 day, right?
Yes, correct.
And basically, do we need to inform the nursing home?
Yes. You need to inform the nursing home as well, because he is in the same nursing home as other residents. So other residents also might have risk of developing this condition, and therefore they also need to be on this prevention dose. And also, I forgot to mention one thing is I will also notify the health department, authority department, regarding this their father having this infection, so that the health authorities, they can come and visit the nursing home, and they can do some checks, and also to treat or to manage the other nursing home residents.
Oh, that's good, doctor. Okay.
Do you have other questions for me, Mr. Go?
No, I'm okay. I understand other condition now.
All right. So before we go off, I will just pass you some pamphlets regarding regarding information on this disease, and also the basic treatments, and also how to monitor. You can read in your free time. Also, you can share with the other family members. All right.
Okay. All right.
Okay. Thank you, Mr. Go.
Yeah. Thank you. Okay. I think you have like about 25 seconds left. But I think we can end it early. It's okay. So every time when com skills scenario, when you finish a bit earlier than usual, right? You think that maybe you have missed out something that you can mention. Oh,
Mm.
so in this case, do you think is there anything that you think you should mention?
Uh,
If you have more time and when you talk
I
when
think
you
just
are given more,
maybe more explore more of the social history lah. I mean,
yeah, the social is one of it. How about the management?
management.
Yeah, I mean the meningitis, the treatment is antibiotic, right? But anything other than antibiotic?
Probably those non-pharmacology like the ward management. I mean, hand hygiene, contacts, all that, the prevention, risk or infection control, all these things are
So actually, you can also always mention that management, right? Always mention multidisciplinary approach
okay.
because it's very narrow when you mention just antibiotic, right? You should mention involved because he may be immobilized for a few days, right? Because he's unwell.
Yeah.
So make sure you can mention that also refer to occupational therapists, speech therapists, physiotherapists to make sure that he will get up and rehab and make sure his condition can get better. Huh? So and the disease notification and the contact tracing, ideally this notification should be mentioned by your side. Huh? That's why when I try to alert you back, then you say that yes, should alert, should notify. So you mention this, and you should also mention that the occupational I mean the what we call as the authority, the what we call public health authority. Yeah, that's the correct term. The public health authority will investigate it and they will provide the necessary precaution and isolation to the other patient in the nursing home. Huh? And generally, I think you are quite good. I mean, the flow is very smooth. The flow is very smooth, and probably just a bit on in terms of the discussion because I feel like your template is there, but you're not following the template. Meaning to say, you explain about disease. This is a scenario of explaining disease, right? Based on the types of scenario. So this is explain disease and the management. So when you explain about disease, you should always mention, I mean, you define it is an infection or inflammation. Inflammation is some people they consider as jargon. You can say soreness, or you don't want to mention inflammation, you mention it's an infection. You can just mention infection. Okay. Or the brain protective membrane called meninges. You want to mention that? Okay. And you should also mention about this. I mean, go by the approach, define, symptom, complication, outlook, and the management. So you should follow that kind of approach because you didn't mention anything about symptom. So you should also mention some other symptom that was not mentioned by the surrogate. Because surrogate only mentioned about these three, right? Irritability, next symptom, possibility. But there's also possibility of rash. And also we know that meningococcal meningitis can cause very severe pupillar fulminans, right? Those kind of skin rash.
Yes.
That's why it's important for us to mention as well. So, and the complication can be very severe and life-threatening without treatment. And you need to mention about the outlook if you know, and then the management. Measure is to always mention that yes. So this scenario, the tricky part is the isolation, disease notification, and also the contact tracing. Basically, these are the additional things other than just explaining a disease. And the isolation period generally only the first 24 hours from the appropriate antibiotic use. So after 24 hours of antibiotic, actually he does not need an isolation anymore. But yes, you can still mention you need to practice hand hygiene and standard precaution when you see him in the ward. That you can. Okay. But generally, the droplet precaution is only for the first 24 hours from the appropriate antibiotic use. And I mean, this is just the discussion. I think you did very well. Shouldn't be any issue. But this is just to some extra point to make it better. Okay, you asked about idea, everything. And another thing is that for this kind of scenario, if you're talking to a patient next of kin, you don't have to invite other people to join the conversation. Okay. The scenario, this is the rule. If you're only talking to the patient, yes, usually you will need to invite anyone else want to join the conversation or the discussion, except those very sensitive cases like HIV, like genetic testing, very strict confidential case, you don't want to invite. But if you talk to family next of kin, you don't need to invite because the scenario which I didn't mention here is usually in the RCB they will write here, patient has given permission to the son to talk to you. Okay, they will usually mention that. Okay, if they don't mention that, also they will this is assumedly patient has already given consent to the patient, to the next of kin to discuss about his condition. So therefore, because of this statement, it means that the patient only given the consent or the permission for the son to talk to you, not any other people else. You see, so that's why it's not necessary to mention about to mention invite again other people want to join. So you just mentioned that you are the son. Yes, I've received permission. If usually the scenario will mention that like, if the scenario didn't mention that also is considered assumed. But if you want to play safe, you don't want to mention that. So you just mentioned that understand that you are the son of this. Is it correct? Okay. We are here to talk about your father condition. Would you mind to tell me what have you understand so far about his condition? Just like that, lah. Oh? But you don't have to fight for this kind of scenario. Oh? And yes, in fact, define part infection, potential membrane around the brain and spinal cord. And the idea is actually to mention that it actually can affect anyone. Okay. And the symptom includes the fever, can mention high temperature, feeling sick, blah blah blah, and at time rash can be, this is the classic. I don't know why they mention like that, but basically they want to mention about sepsis. This is a classic description of purpura fulminans that was mentioned in the NHF leaflet, or even the NHF website. If you look through and read through again, it's a rash which does not fade when the glass is rolled over. Basically, it just means a very fragile kind of skin, like a purpura fulminans kind of thing, which is a sign of blood poisoning. Okay, so in the com skill we don't mention sepsis. Just like in com skill, we don't mention pathogen. If you mention pathogen, you kena potong satu maka already. Just now you accidentally mention pathogen. So you can just mention bug instead of just mention. Yeah, try to avoid because we use it very frequently. Sometimes in the exam, we will accidentally say something that we don't want to say. Just like sepsis, you don't mention sepsis, you mention blood poisoning. Just like any bug, like fungal or whatever, you just mention bug. Okay, infection can also bug. Bacteria called Neisseria, or you don't want to mention also can be just one type of bug. Can spread to one person to another. The reason why I ask you the cause is actually usually the cause is transmitted spread from sneezing, coughing, or kissing, and usually come from people carrying those bugs in their nose or throat, but they are not symptomatic. They are not ill by themselves. It can be just a colonizer in the nose or throat. So therefore, and this scenario is also not necessary for you to ask the details on the transmission part. You don't have to know what any sick contact before all this. It's not important because the history taking should not take. I mean, the communication skills should not consider as history taking, right? But this certain question is like exclusion. For example, you got needle stick injury. Therefore, you need to know the event, and that for that reason, you have to ask in detail about the needle contact and what happened after that. That is fine. But for this kind of scenario, actually, you don't need to ask. It's okay. You just mention that usually, instead of asking the patient or the next of kin, what are the possible source, right? Another more intelligent way is to just mention. Usually, it can spread from the person to person through this and that, and you can talk from normal people that carry this bug in their nose and throat. Just like that. You don't have to explore the cause already, right? If you mention like that. Yeah, I would say it's a safer way to do that instead of asking the history. Another thing is less commonly you can also talk for someone who have the same infection. And generally people can also get more than one episode without treatment. And the outlook is usually good if being treated quickly, and most of it we can make into full recovery. However, some can have serious long-term problem. About 1 in 10, the infection in the brain can be very fatal. And for this scenario, because Nisa mentioned is something quite serious, under the complication, you need to elaborate a bit. You mentioned about something wrong with the brain system, right? You mentioned about you can elaborate more about movement, balance, memory, concentration. Even though I mentioned that is okay, but you also need to mention something about seizure. Can have some episode, can also affect hearing or vision. And this is also mentioned in the NHS website. Therefore, I put it here because in a certain meningococcal meningitis patient, they will have a very severe necrosis or gangrene. They may even warrant amputation. So sometimes this thing also need to be mentioned because it's also a serious complication, right? So you need to mention about this. And other rare problems like kidney all the joint problem, if you don't mention, it's okay because time is quite tight. But I think the important one you need to mention: problem with the brain, yes; seizure, yes; hearing loss and vision, yes; and also the amputation. I feel amputation is something that is quite important to mention. And then in terms of the management, yes, you mentioned about it's curable, antibiotic admission, and in terms of the other management than antibiotic, you can always mention about fluids to make sure the body is well hydrated, oxygen therapy, painkillers, and because scenario outside also mentioned that irritability, neck stiffness, right? I mean, you can give some painkillers as well,
Mm.
and also some anti-stiffness drug if needed. And you also need to talk about MDT approach. Can mention all that. And mental health also, because a lot of patients with meningitis, they can get into depression as well. If needed, you can mention that. And then hearing aid, if let's say the scenario mentioned, so if not mentioned, it's optional whether you want to mention or not. Admission and isolation, first 24 hours isolation, full doublet precaution. Subsequently, no need special isolation, just got standard precaution with hand hygiene, like you say. Notification, yes, you have to mention that inform the occupational health service and public health for further tracing and isolation. No? And then the antibiotic, and then the so-called the close contact. This is something mentioned in the NHS as well. What is defined as close contact? Those living in the same house, sharing a dormitory, or partner couples, or even let's say university students staying in the same residence. No? Sharing the hall or residence already considered risk factor. So something in the close environment in contact is already considered a close contact. Okay. So yes, if you got time, you mention a bit on the social history. Okay. And the concern that I won't ask you this question definitely, but I just put here so that everyone knows that what are the options of antibiotic prophylaxis. In the olden days, this kind of scenario in the Viva session, examiner will ask you what are the options of antibiotic prophylaxis. So yes, you're good. You mentioned that you can only give one type of medication for one dose is enough. It basically means it's just Cipro. And then there's also options of rifampicin, IM ceftriaxone, or azithromycin. For example, in pregnancy, you can give azithromycin because pregnancy cannot give Cipro, right? Try to not to Cipro. And if the patient pregnant, then you can also give, there's also another medication available. But generally, all these things will not be tested anymore because it's no longer got Viva session. And in your summary, I think you concluded very well. You mentioned about different brochure, website, everything. But another thing you need to mention is sometimes support group is something we tend to forget also. If patient have long-term, a condition that may have some long-term complication or sequelae, it's also good to mention about support group. Like this is the one extracted for NHS as well. I don't think our Malaysia have any support group of meningitis, but we just need to mention because it's a UK exam. To mention about, you can also refer to support group in which those patients that already survived from the meningitis, they can share their experience and provide some advices about their life and also hospital contact. Okay, Jenny. Other than that, you do very well already. You're quite prepared. Okay.
Thanks.
Any question? No problem. Any question you want to ask me?
So far, okay. Thanks for
So
explaining.
far, okay, right? Yeah. Thank you. Anyone else got any other question? If not, we will end our day. Yeah. Just for advertisement a bit, I still have a few more copies with me for the reference book that I'm doing for the revision. If anyone keen to purchase, can just scan and then fill out the Google Sheet. I will contact you from there. And then those that join here, this link not in the campfire group want to join in